Board. Before we convene, I would like to advise all individuals observing or participating in the meeting that the meeting is being conducted consistent with the provision of Governor Gavin Newsom's Executive Order N-29-20. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website for how to do that. All of the lines are currently on mute as I conduct this meeting, with the exception of our council, to allow for proceeding in an orderly manner and with full participation. Lines will remain on mute until I direct staff to open the lines for public comments. I will announce when we are accepting public comment on the various issues, and staff will open lines as appropriate. The staff will allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting and ensure the board has the opportunity to complete its necessary business. We appreciate everyone's understanding and patience as we navigate this meeting format. Before we get started, I would like to ask the staff moderating the meeting to provide general instructions.
Thank you, Mr. Board President. This is the moderator of the meeting. Welcome to the Physician Assistant Board meeting. Before we get started, I would like to remind board members and senior staff who are not speaking to mute their microphone. If I detect background noises during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute the microphones. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When the board president reaches a point in the agenda at which public comment is appropriate, public comment will be requested. At the board's direction, I will turn on and announce the opening of the question and answer feature. Please note the question and answer feature is only being used as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the member of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you're free to express criticism or negative views, for the sake of the public members participating on the call, please do not use profane language when making public comments to the board. And now I return the floor to you, Mr. Board President.
Thank you, Tricia. As indicated on the agenda, the board will convene in closed session after deliberating on all of the open session items except for adjournment. Due to technological limitations, adjournment will not be broadcast. Adjournment will immediately follow our closed session, and there will be no other items of business discussed. I would also, because I am currently on military orders, like to take a brief moment to thank the 40th Combat Aviation Brigade Commander, Colonel Gronwald, as well as our brigade surgeon, Lieutenant Colonel Goldsmith, for freeing me up from my military obligations to conduct this meeting today. I would like to now take a roll call and establish a quorum. So, Julie, if you could do that. Members, as your name is called, please remember to unmute your line before speaking.
Good morning. Charles Alexander.
Present.
Juan Armenta. Jennifer Carlquist.
Present.
Sonia Early.
Present.
Jed Grant.
Present.
Randy Hawkins.
Here.
Diego Nzunza. Is that how you pronounce it?
Yes, present.
Okay. With a quorum being established and noting for the record that Mr. Armenta has noted that he will be arriving to the meeting somewhat late due to a prior obligation, we'll go ahead and entertain any public comments for any items that are not on the agenda. To facilitate this portion of the meeting, as previously announced, the staff will open the phone line for individuals to provide the opportunity to make a public comment on items that are not on the agenda. You are not required to identify yourself, but you may do so. As the lines are opened, I would like to remind everyone that the board cannot take action on these items to decide whether or not to place them on a future agenda. Members, following review of the public comments for this agenda item, I will ask the staff to open the lines for members to request that any of these items be placed on a future agenda.
Thank you, Mr. Board President. This is the moderator, and if you would like to make a public comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and send it to all panelists. We are displaying instructions for your reference, and we have an individual identified as Ed Howard who would like to make a comment. And Ed, just a reminder that you have a 3-minute time limit. I will give you a 30-second warning, and I'll let you know when you've been unmuted. Ed, you've been unmuted.
Thank you. Good morning. Ed Howard, appearing on behalf of CAPA. I begin your board meeting today with an apology. We here at CAPA had 2 problems related to your August 7th meeting that regrettably led us not
This is the
to
moderator.
not offering.
And Ed, we could hear you initially, but somehow we're not hearing you now. I don't know if perhaps you accidentally muted yourself on your phone. I can see you called in on your phone.
Yes, I did. Can you hear me now?
So Ed, we can see that you're talking, but we can't hear you.
I can hear him.
I
Oh,
can hear.
it looks like I'm the only one who can't hear you. My co-moderator just explained. So,
Well, with
okay.
your permission, I'll go back to apologize. We had 2 problems related to the August 7th meeting that regrettably led to us not offering comment on the draft regulations that were then under discussion. The first is just we had technological difficulties logging in. But more robustly, whether it was because of problems related to the materials for the meeting getting online, President Grant expressed concerns at the last meeting I heard during the webcast about whether or not the public had access to those materials, or whether it was because of those problems or we somehow simply missed it. When we saw the August 7th agenda item that said that the board was to consider, quote, initiating rulemaking, end quote, we inferred, as it turns out wrongly from that in the absence of seeing any actual language, that the item was going to be about simply deciding whether to begin drafting, not whether to consider an actual draft. And as a result, the first time that I realized that actual language had been proposed to the board was last night, as I reviewed the board packet today, and I saw the proposed draft included verbatim in the meeting minutes. Now, happily for us at CAPA, and as correctly forecast by President Grant during the last meeting, the proposal that we would have had respectfully the most objections to was the one that President Grant suggested be withdrawn, as in several ways inconsistent with SB 696, namely the proposed changes to 1399.545. And as an aside, I don't see any in the materials for this morning. I don't see any new proposals or changes to any of the regulations in the packet. Anyway, on behalf of CAPA, all I can do is sincerely apologize for not getting our thoughts to you earlier. We commit to the board to have written comments on the proposed language, including the withdrawn 545, by the end of this week. And all I can do is thank you in advance for your consideration. Thank you in particular to President Grant for his comments at the last meeting about 697's intent. And we are pleased to partner with the board moving forward on these important regulations. And once again, thank you and our apologies. We look forward to working with you.
This is the moderator, and thank you, Ed. You can lower your hand by clicking on that icon a second time. And Mr. Board President, I see no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. That would be great. Thank you.
All right, it's been closed.
Seeing no further public comments, we'll move on to the next item on the agenda, which is item number 3, which is approval of the August 7th, 2020 board meeting minutes. I hope that all of the board members and, as just mentioned, members of the public have had a chance to review those board minutes. Do any of the board members have any comment or correction on the board minutes? Hearing no comment from the board members, is there any public comment on the minutes in terms of needing correction?
Thank you. I will go ahead and open up the Q&A panel. All right, if you'd like to make a comment, please type "I would like to make a comment" and submit it to all panelists using the field in the lower corner of your screen. We are displaying instructions for your reference. Mr. Board President, I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please. That would be great. And we'll look for a motion from board member to
approve the minutes.
I'll second. This is Jen.
Okay, great. So I hear a motion from Sonia Early to approve the minute with a second from Jen Carlquist. Any further comment by board members? Okay, Julie, could you call the roll, please?
Yes. Charles Alexander,
Aye.
Juan Armenta, Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Randy Hawkins,
Abstain.
Diego Nzunza.
Aye.
Okay, so the motion carries. And the board minutes, the minutes from our last board meeting are approved. The next thing, yes.
Hey, Jed, this is Will. Sorry, just to, I guess, a educational moment for some of our new members. Will McGuire, Board Counsel. Good morning, all members, new members, and existing members. Just to let you know, for future items, including minutes, if you weren't present at the board meeting minutes, the board meeting about which we are voting on the minutes, such as August 7th, you're not required to abstain. As long as you may abstain, of course. You're not required to, as long as you've reviewed the being and found seemed to tell a coherent story, and there's no factual errors or a typo or anything. You are free to, as a qualified board member, you're free to vote. Although I guess I should clarify with that all the new members, while they haven't been, you have already been technically sworn in. In fact, we're going to do a ceremonial swearing in here in a few minutes.
Yeah, I believe that's correct. They've all submitted their oaths.
Okay, perfect.
Dr. Hawkins, may I speak?
Yes.
So I did have a conference call with Ms. Khan. I did request the minutes. I did review them, so I would change my abstain to yes.
Okay, we'll note that the vote then is unanimous to approve the minutes, and the minutes are approved. Thanks, Will, for your input on that. Okay, moving on to agenda item number 5, which is the introduction and swearing in of new and reappointed board members. And for simplicity's sake, I think we will go in alphabetical order. So the first board member that we will swear in has been reappointed is Charles Alexander, Dr. Alexander. So I'll ask him to turn on his video and unmute his microphone. So for anyone who wasn't on the call or on the meeting earlier, I am currently on military orders, is why you see me in uniform. And Dr. Alexander, although I'm not representing the United States Army or anything right now, I am in uniform because I am on duty. So Dr. Alexander, if you could unmute your microphone and turn on your video, we will administer the oath.
Okay, done.
All right. And if you will raise your right hand and repeat after me. And this is the oath for the office of board member of the Physician Assistant Board. So raise your right hand. I, Charles Alexander,
I, Charles Alexander,
do solemnly swear or affirm
do solemnly swear or affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully
and that I will well and faithfully
discharge the duties
discharge the duties
upon which I am about to enter.
upon which I'm about to enter.
Excellent. Congratulations.
Thank you. Do I salute you, Jet?
Nope.
Veteran Day is coming up, so
Yeah, it is. Thank you very much. We're very happy to have your continued service on the board, and thank you for your service over these last many years. We're really glad to have you.
Thank you as well, and thank you for your service.
Thank you very much for your support. I appreciate it. All right. Next, we have Jennifer Carlquist. So, Jen, if you could unmute your microphone and turn on your video, we'll administer the same oath for you.
Okay. All right, Jed, I'm ready to go.
All right. So, raise your right hand. I state your name.
I, Jennifer Carlquist,
Do solemnly swear or affirm
do solemnly swear or affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well
and that I will well
and faithfully discharge
and faithfully discharge
the duties upon which I am about to enter.
the duties upon which I am about to enter.
All right. Thank you very much.
Thank you.
Also, of course, appreciate you being here. I might just note that this is the same oath that we take when we enlist in the National Guard. It's kind of interesting that the wording is the same. So your duty is a little less demanding than those of the National Guard, but still, thank you for your service to the board. We really appreciate it.
Thank you, Jed.
Okay. All right. Next is Sonia Early. Sonia, if you could unmute your microphone and turn on your video.
Hello.
All right. I hear you, but I don't see you. Okay, there you are. All right. All right. Are you ready, Sonia?
Yes, I am.
All right. Raise your right hand. I state your name.
I, Sonia Early,
Do solemnly swear or affirm
do solemnly swear or affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well
and that I will well
and faithfully
and faithfully
discharge the duties upon which I am about to enter.
discharge the duties that I'm about to enter.
That I will discharge the duties upon which I am about to enter.
That I will discharge the duties that I am about to enter.
Upon which I am about to enter.
Upon which I'm about to enter.
Excellent. So I pulled for those of you that might remember Mr. Sachs, when I took the oath last time I was sworn in and he administered it, he took one break in the oath. That was it. So I did that to you there, Sonia. I apologize for that. I didn't mean to go too far there.
No problem, no problem. Thank you for your service.
Oh, thanks for your support. And again, I really appreciate having you on the board. I think you bring really valuable insights. So thank you for continuing to serve on the board.
Thank you.
Okay, next is going to be Dr. Hawkins. And before we start with Dr. Hawkins, I would just like to introduce him a little bit because Dr. Hawkins and Diego are new board members. And so Randy W. Hawkins, MD, was appointed by Governor Newsom to the Physician Assistant Board on August 17th, 2020. Dr. Hawkins has been assistant professor at Charles R. Drew University of Medicine and Science since 2014 and a physician and surgeon in private practice since 1985. He is board certified in internal medicine and pulmonary and critical care medicine. Dr. Hawkins is a member of the Golden State Medical Association of California, the National Medical Association, the Charles R. Drew Medical Society, and the Food and Drug Administration Cellular. So Dr. Hawkins, we are certainly glad to have you on our board. If you could unmute your microphone and turn on your video, we will administer the oath.
Thank you, and I'm pleased to be here.
All right. Looking for the video. Excellent. So I state your name.
I, Randy W. Hawkins,
Do solemnly swear or affirm
do solemnly swear or affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith
that I will bear true faith
and allegiance
and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well
and I will well and that I will well
and that I will well
okay
and faithfully discharge
and faithfully discharge
the duties
upon which
I am about to enter.
I'm about to enter.
Very good. Thank you, Dr. Hawkins.
My pleasure.
Certainly appreciate you being a member of our board. Dr. Hawkins is also a member of the medical board, and his seat has been vacant for some years. So we are very pleased to have him serving on our board for valuable input from our physician partners. Okay, the last person to swear in is Diego Inzunza, and I will, as he gets his video and microphone ready, also read some information about him. So Diego V. Inzunza is a licensed physician assistant that was appointed to the Physician Assistant Board by Governor Gavin Newsom on August 17, 2020. Mr. Inzunza has been a physician assistant at VEP Healthcare, Patterson Urgent Care, and Primary Care at Home since 2019. He was a group supervisor for San Mateo County Probation Department from 2015 to 2019, a medical translator for Santa Clara County from 2012 to 2016, and a community outreach coordinator for the City of San Jose Vice Mayor from 2010 to 2014. Mr. Inzunza is a member of the California Academy of Physician Assistants and the American Academy of Physician Assistants. He earned a Master of Science degree in Physician Assistant Studies from Samuel Merritt University. All right, Diego.
Yes.
All right.
Thank you
Can
for
you?
your service.
Looks like oh, there you go. Okay, we got you. So let me have you raise your right hand, and I will administer the oath and get it to come up. There we go. I state your name.
I, Diego Inzunza,
Do solemnly swear or affirm
do solemnly swear or affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic.
foreign and domestic,
That I will
that I will
bear true faith and allegiance
bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California.
and the Constitution of the State of California,
That I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion.
or purpose of evasion,
And that I will well
and that I will well
and faithfully discharge
and faithfully discharge
the duties
the duties
upon which I am about to enter.
upon which I am about to enter.
Very good. Thank you. Glad to have you on our board. I know it's a big commitment in time to do that. So appreciate you being willing to step up and do that, especially as someone who sounds like you have lots of jobs. So appreciate you being willing to serve on the PA board and look forward to having your input and participation.
No problem. Thank you all for your service, and I appreciate working with you.
All right. Happy to have you. Okay, so now we have everybody sworn in. We're happy to have everyone here. Just noting again for the record that Mr. Armenta will be here a little bit later. And so until he gets here, I think that we will move past number 6 and go on to item number 7, which is the president's report. So the first thing I would like to do is recognize our new board members. Certainly appreciate them stepping forward to serve on the board. So thank you for that. I would also like to recognize Jennifer Carlquist, who was nominated as one of the top 10 PAs in the country in cardiology by her peers. So the Point of Care, I think, network is what it stands for. The POCN was built specifically to provide nurse practitioners and PAs with peer-reviewed resources to learn, care, and connect. These resources and tools have been vetted by an editorial board, and they all got together and nominated the people that they felt were the top PA in various specialties in the country. And Jennifer, who is on our board, was voted the best PA in cardiology in the United States for 2020. So congratulations to Jennifer. Appreciate your contributions. For those of you that don't know, Jennifer is a frequent speaker at continuing medical education conferences on EKG interpretation and cardiology issues. So congratulations, Jen. Appreciate your contributions to the profession and well-deserved award.
Thank you, Ted. I really appreciate that.
Of course. The next thing I would like to do is familiarize the public with some of the executive orders that were extended during this time period. So on March 4th of 2020, the governor proclaimed a state of emergency related to COVID-19. And we do have some emergency orders. There was an order waiving physician assistant supervision requirements under certain circumstances. And so that order has been extended several times. And currently the order is extended through December 10th, 2020, unless it is further extended related to the COVID pandemic. These are posted on our website. I just wanted to make sure that we mentioned that the public was aware that these orders had been extended, allowing under certain circumstances and condition for PAs to practice without a practice agreement, and that is to make sure that we are not hindering the ability of PAs to provide healthcare during this crisis. Additionally, there was a executive order to waive some of the requirements that are in place for renewal of licenses. A little bit difficult to get some continuing medical education during this time, and so didn't want people to not be able to renew their license during a time of a pandemic when continuing medical education may not be available. So that waiver has also been renewed, and that will be in place until December 31st, 2020, unless further extended by DCA. And then finally, there is a waiver in place license. So many of the requirements to re-enter practice have been place until January 1, 2021. So if there are retirees that want to render aid to do that. So that is pretty much it for the president's report. As we want to make sure are familiar with those executive orders, which are posted on our website. The board staff is available. Help licensees understand what they need to do to be compliant under these waivers, which are in place basically until the mid or end of December in order to assist with the pandemic. So any comments from board members on any of that? Public comments on the president's report.
This is the moderator, and Mr. Board President, you were cutting in and out quite a lot there, so I'm not sure if your fellow board members heard the invitation to participate or not.
Okay, sorry about that. It looks I'm sorry for the technical difficulties there. I just was inviting board members to make a comment on the president's report if they should so desire. Okay, hearing no comment from the board members, are there any public comments on the president's report?
Thank you, Mr. Board President. This is the moderator, and I have opened up the Q&A panel. If a member of the public would like to make a comment, please type. I would like to make a comment in the panel or field in the lower right-hand corner of your screen. We are submitting or displaying instructions. This is the moderator. And Mr. Board President, I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please. And yeah, hearing no comments from the board members or the public, we will move on to the interim executive officer's report. Rosanna.
Good morning, everyone. Can you?
Yes.
Okay.
Yes, we.
So the first item is the pandemic response. The board's office is operational and open to public during the pandemic. Board staff continues to be on a rotational telework schedule and are able to provide essential services to applicants, licensees, and consumers. Personnel, the board's licensing program is currently understaffed due to the departure of the licensing analyst and the lead licensing analyst effective August 24, 2020. To maintain coverage of these essential functions, Julie Caldwell, our administrative analyst, was redirected to the licensing analyst position. Ms. Christy Boone, probation monitor, has also stepped up to temporarily assist while the with the licensing workload. The board is in the process of recruiting for the administrative analyst position, lead licensing analyst position. In addition, the board is also in the process of recruiting for a discipline analyst position. As you may recall, this position was approved through the budget change proposal in an effort to bring the enforcement workload in-house from medical board. Any questions before I move on? The next item I have is the update on the sunset review report. Since I wrote this report, there's another update that I received on Friday, but I'll just read this one first. Board staff was recently advised that sunset review oversight hearing will resume in the near future, which now we do have a date. It is now November 19th. So we do have a hearing date. The committee will continue to utilize the sunset report submitted last year and requested that the board provide any relevant updates or revisions. In addition, the committee is requesting responses to supplemental questions related to COVID-19. If you in the packet, it's attachment 1. Any sunset report updates or revisions along with the responses to the supplemental questions is due to the committee electronically. And the report says on or before December 1st, but now our timeline has moved up, so we need to work on it ASAP. I will be working with the board president and the legal counsel to formulate responses to that. The next item is social media. The board's 2019-2023 strategic plan objective 4.1 is to utilize social media to maximize outreach and communication. We're pleased to announce that the board now has a Facebook presence and a Twitter presence. Just as its website, the board is now utilizing these social media platforms to disseminate all board-related information and/or updates. Any questions on those? Hearing none, that concludes my interim executive officer report. Thank you.
Thank you, Rosanna. I didn't hear any comments from board members on your report. We could ask the moderator to open the line for any public comment on the interim executive officer's report.
Thank you, Mr. Board President. I have opened up the Q&A panel. So if a member of the public would like to make a comment, please type, "I would like to make a comment," and submit it to all panelists. We are displaying instructions. This is the moderator. I see no request for public comment at this time. Shall I close the Q&A panel?
Yes, please.
All right, it's closed.
Okay.
Hi, this is Will, Board Counsel. I just wanted to clarify my previous advice and give an update because I got some new information. And sorry, I think you guys maybe couldn't hear me that well on I switched computers. Are you hearing me better now?
Yes, we can hear you clearly.
Okay, excellent. Well, previously I was just pointing out about abstaining on an item, and I didn't realize at the time that Dr. Hawkins is our ex officio member, which technically means non-voting. So I guess in the future, going forward, we just when we're calling the roll, we'll just, if it's all right with Jed and Dr. Hawkins, we'll just skip over Dr. Hawkins' vote. Dr. Hawkins can, of course, make any comments that during board discussion or anything like that. But I think that's the best way to go forward. And if it's all right with Jed and Dr. Hawkins, we'll revert his original vote back to abstention.
Yeah, that sounds great. Thanks for clarifying that, Will. Appreciate it. Just for the public and other members of the board to know, Dr. Hawkins' position at times has been a voting position and at other times has been a non-voting position, but the legislature has currently made it a non-voting position. So thanks for the clarification, Will. We'll proceed now to item 7C on the agenda, which is the board activity reports. And then I think we will, once we have concluded those reports, we will have a break. So first up, I think will be Julie with the licensing report.
Good morning. Moderator, if we could bring up the first licensing report, which I believe is page 55 of the packet.
Hi, this is the moderator. So you would like to go to the meeting agenda materials?
Yes, please.
Okay, hold on just a moment. I didn't realize you'd be asking them, but I can certainly bring them up. So let me just grab them real quick. All right, and you said what page?
55.
55?
Correct.
Oops. Hold on just a moment. My computer's okay. A little bit of technical challenge as my computer struggles here. I'm going to go ahead and make my co-moderator the. Oops. Sorry about that. My computer's freezing for a moment. Okay, and let me change the view a little so we don't have to crane our necks. Sorry about that. All right, there we go. Does that look good?
Yes, thank you.
Okay, you're welcome.
So the first report is the licensing population by type. And what this does is it just gives an overall view. If you scroll down just a little bit for the definitions for license status, we have current and active, we have family, delinquent, so on and so forth. So the total licensing population is 20,416. We have 14,155 current licensees, 30 inactive licensees, and 1 license that's temporary family support, which gives us a total of 14,186 current licensees. Okay. If you go to the next screen, which is page 56, that would be the summary of the licensing activity. And so during the period of July 1st, 2020 and September 30th, 2020, we had received 464 applications, issued 305 licenses, and received 1,643 renewal applications. The next report is on page 57, and this is the pending application workload. So currently, just transitioning from Sarah into other staff members to take over the workload. It does reflect, how many applications are assigned to each individual. But we currently have a total of 367 pending applications. And I know that originally Sarah used to provide an explanation as far as like the desk age and the pending, what the difference is. That would be covered on the next screen as well, which is page 58. That would give a pending application workload. That's the application age. And then you also have the desk age. So the application age is from when we initially get the application, and the desk is when it's assigned to somebody. And we're currently, those are the current figures right now. So 0 to 30 days for the desk age is 210, 31 to 60 days is 87, 61 to 90 days is 12, and 91 plus days is 58. Any questions on this pending application workload?
Julie, this is Jed. I just am noting that you are, there was a pretty big staff, you lost 2 staff members, right? One went to another board and one retired. So you guys have kind of been shuffling to cover these. Is that correct?
Correct. So Sarah and Anita both left by August 24th, and Christy really played a major important role to keep licensing moving forward. So she was instructed by Sarah how to review applications and continue to issue licenses. So it kept the desk moving forward and really beneficial. I didn't come back to work until the week of September 15th. And then that first week was just catch up for me with other projects. And so then I assumed the licensing desk probably the second to last week of September. So it's been a group effort in the office. I'm working from home multiple days, so Christy's my go-to person in the office if I need hands-on to a file that I don't have. So we are been providing great assistance to the applicants because we do have somebody in-house that can check their actual file if I don't have access to it from home and give them an update on where they're at. But we've really closed the gap between, I think, when I came on, it was about 48 days out, and we're now reviewing applications that we received October 6th. So we're really, narrowing that gap back to that 30-day range. And it's really been a group effort by everybody in the office, from answering questions to forwarding emails to looking in the Pendaflex for file or, missing documents. So I really praise just the staff coming together to make sure that, the applications move forward.
Great. I just wanted to make sure to take an opportunity to thank everyone, all of the board staff, but especially you and Christy, Low. We have a goal, I think, if I recall correctly, of on the desk for an application, and you guys.
You're breaking up a little bit again. Sorry.
Certainly when we're 2 people short. So.
Yeah. So basically, that one report that shows that we have about a 43-day processing time. So the final screen, which is on page 59, the licensing performance measures, it does show processing time of about 43 days on average from when we receive the application to when we issue a license. And I ran the report this morning, and we're at about 33 days now.
That's really great and very impressive that you can do that. I know there's we're pretty short staffed, so appreciate everyone, all of the board staff. I know this has been kind of a group effort. Everyone has been pitching in, but especially you and Christy. So appreciate that.
No problem.
Okay, I think what we'll do is are there any comments from the board members? We'll reserve the public comment on the activity reports, I think, to the very end, but I want to make sure board members have the opportunity to ask questions at each one. So any board member questions on the licensing report? Okay, hearing none, let's move on to the enforcement report. I'm not sure if it's just me or I'm not hearing either Armando or Rosanna. If the report is being delivered, I'm not hearing it.
Hello?
I heard someone say hello.
We can't hear Armando. Armando was the one, he will be doing the complaint intake report, but looks like he's on mute, but we cannot hear him.
Okay, maybe the moderator can help him with that, and if not, then we can go to the probation report and come back to enforcement.
Armando's gonna join me in this office, so he's here now.
Okay, great, thank you.
Good morning, can you hear me now?
Yes, we can hear you.
Hi, good morning. My name is Armando Ernesto Melendez. I'm the board's complaint analyst. Today, I would like to provide you information from our enforcement activity report. And this is going back from July 1st, 2020 to September 30th, 2020. I will be providing you the following: complaint intake, complaints and investigations, suspensions, office complaints at the Office of Attorney General's cases, formal actions, field withdrawn and dismissed, administrative outcomes, and final order, citations and fines. So I'll start off with the first one. We have in that time frame we have received 97 cases. 97 cases were assigned to the desk analyst. 8 are pending at the intake during that time. The following would be complaint investigations. We have 15 complaints that were referred to for investigation. 67 complaints and investigations were closed. 127 complaints pending at the desk. We have 85 investigations pending at the field. 292 is the average of pending cases, investigations. We have 52 investigations over the 8 months that are over 8 months old. Suspensions. Currently, we have none that are on automatic. None during that time frame that are automatic suspension order. We have none that were a cease practice order, and we have none that were in an interim suspension order. Cases. The Office of Attorney General. We have 5 cases that were initiated. We have 32 cases that are pending. And then we have 390 cases that were the average of
Average age of pending cases.
Their average age of pending cases. For formal field and with for formal actions that are in the field with or withdrawn or dismissed, we have 6 there were accusations that were filed. 0. Excuse me, 1 second.
So we had 6 accusations that were filed. We have 1 accusation or a petition to revoke probation that was filed. And then the administrative outcomes, we have 4 probation. We placed 4 licensees on probation. There was 3 licenses that were surrendered. As far as the citation and fines for previous quarter, April 1st, 2020 to June 30th, 2020, there's 2 pending. Fine total from that is $750. As for the current quarter, July 1st, 2020 to September 30th, 2020, we have not issued any citations and fines. This is mainly due to that we have suspended the CME audits at this time due to the waiver. So right now, fines due from previous and current quarter is $750.
Moving on to the next section. There's 2 charts that we have here. The first chart will provide you information on the type of complaints received from July 1st, 2020 to September 30th, 2020. And the second chart is for the last fiscal year Please let me know if you have any questions. Well, we added some definitions at the bottom of the charts as well. Is there any questions?
Okay, hearing no questions from the board members. Again, we'll have public comment on the end of all of the reports together. I think this chart is the one with all the colors on it. The complaints received by type and source is pretty helpful in terms of trending our complaints and looking for areas where we might have significant issues. Again, it looks like gross negligence and incompetence and unprofessional conduct are the main categories that we get, which makes sense, and that's why we have a PA board, right? So that we can look at those things and make sure that if a provider has a problem, that we're taking some action on that. So, thanks, Armando, for that report. Appreciate it.
Jen, Armando does have an update on the complaint unit that we have now.
Yes. Yes, I wanted to update you on a few things. So I would also like to inform the board members of what is new since the transition of the complaint process from the medical board to the PA board. Since the transition period, we have created new forums such as the complaint form and the medical release form. We have also created new template letters that we'll be using for correspondence between the consumers and licensees. We've also worked on some brochures that we created on, and this is brochures such as the Consumer's Guide to the Complaint Process, most asked questions about medical consultants, questions and answers about investigations, and we're currently working with DCA's IT office in updating this information into our website. So hopefully we'll have it up in the next couple of weeks where it'll update the website. We are also working on a plan to make make our website more accessible and user friendly for consumers as well and licensees. That's something that we're in the process, the early process of just setting up meetings with IT and brainstorming some of the changes that we would like to make or improve on. We are also working on creating a medical consultant program, and where we'll have MDs and PAs that are reviewing our cases for us. But that's something that involves several steps, and hopefully we'll get that going soon as well. Please let me know if you have any questions regarding any of these items.
Thanks, Armando. I think one of the things that the board put in their strategic plan a few years ago was that they wanted to bring the complaints and enforcement process in-house. And so Armando joining our board and then putting all of these changes into place is consistent with the strategic plan implemented by the board a few years ago. And so I just want to thank him for his hard work there. I know this is a big project, but I do think that bringing some PAs into the case review process will give some helpful insight into the various enforcement cases that we have, and especially bringing the whole process in-house, I think is good for us. When we go over budget, there's some changes that are associated with that, but certainly can see these changes occurring consistent with the board's direction. So thank you, Armando and Rosanna, for putting all that. I know it's a huge job, and so thank you for your hard work on getting that going in-house. For the public's reference, the documents that Armando and Rosanna were referencing are page 61 in the board packet. So for the activity reports, if the person reporting could just note what page in the board packet it is so the public can reference that, and that would be helpful. So any comments from board members on the enforcement report?
Jed, this is Jen. I'm really excited that we're going to be able to be involved on the ground level for the complaints coming in. I'd definitely be interested in hearing more about this as it progresses.
Yeah, thanks, Jen. Yeah, it's something we've been asking for quite a while. is to have a PA involved in the review process. So I'm pleased that this is coming along. So thanks, Armando, for the update. And we look, as Jen said, we look forward to getting these updates regularly as you make forward progress on bringing this whole thing in-house. For the public's information, up to this point, all of the complaints from the public or other sources were handled through the medical board. Handled our complaints, and we have grown. One of the reasons that the board put in the strategic plan that we wanted to do this stuff in-house is because the board, we have 14,000 licensees, and there was enough growth that we felt like the board was big enough that we could start to do this ourselves. And so it is a huge undertaking to sort of take this whole process on ourselves. And the medical board has been very supportive, so we thank them for that, as well as the hard work on the part of our board staff in establishing a process of our own within the PA board. Any other board member comments? Okay, great. Oh, I'm sorry.
Yes, actually, Jed, if I could.
Sure.
How I joined a little late, so my apologies. I got done with my trial, but how is this going to affect our ability on selection of experts for disciplinary cases, or should we discuss that in closed session?
Well, I think it will go by individual case, and we'll talk about those things in closed session. But generally, having a PA involved in the process early on, historically, we've seen some cases that might have maybe not resulted in an accusation had a PA been involved early on. And I think those were those few cases. There was very many, but those few cases are sort of where this came from in terms of having expert case review from PAs and physicians, so that we have a better perspective as to whether or not we should, move forward with filing an accusation against a licensee, or how we should process the complaint. So that's sort of where it came from. But for individual cases, we would have to discuss that in closed session. Great question.
Okay, thank you.
Of course. And welcome to the meeting.
Thank you. Yeah, not only did I have my quick trial to do this morning, but I also then, I think the gardeners cut the internet cable to the building out here this morning. So it's been good progress.
Of course. Of course. Any other questions or comments from board members? Okay, great. Hearing none, we will move on to the probation report.
Good morning, board members. This is Christy from Probation Monitor. For the quarter ending September 30th, 2020, there are currently 62 probationers, 53 are active probationers, and 9 are total probationers. For the quarter ending September 30th, 4 licensees entered probation, 5 probationers completed probation, and there was 1 voluntary surrender of license while on probation.
I'm sorry, Christy, I'm sorry for interrupting you. I just wanted to point out for the public or others who may be following along that we are on page 64 in the board packet if they wanted to see the information that you're referencing. Please proceed, Christy.
That pretty much concludes my probation activity report. Are there any questions?
Okay, hearing no questions from the board members, we'll move on to the diversion report.
Okay. For the diversion program activity report. For the quarter ending September 30th, 2020, there are currently 4 active participants. And in the month of September, we have 2 participants that completed Maximus. And this concludes the division activity report. Are there any questions?
I do have a question for you, Christy. Have any of our probationers or those on diversion reported any difficulties in complying with the terms of their probation due to the COVID pandemic? For example, have testing centers been closed, or have any of them reported difficulties with that?
There were some concerns in the beginning, initially in March and April when the pandemic started, but these testing locations, collection sites are still open. So there hasn't been any difficulties. There were concerns of being exposed. However, we continue to refer them to, the CDC guidelines regarding COVID. So right now there are no concerns from the probationers.
Okay, great. Thank you. I was sort of, where I was going with that is, I couldn't comply with my probation because the testing center was closed or something like that. So I'm glad to hear that that hasn't been an issue.
No.
Thank you. Any other questions from the board members? Okay, for the moderator, could we open the lines for public comment on the board activity reports?
Thank you, Mr. Board President. This is the moderator, and I have opened up the Q&A panel. If you would like to make a comment, please type, "I would like to make a comment," and send it to all panelists using the field in the lower right-hand corner of your screen, and we are displaying instructions for your reference. This is the moderator, and Mr. Board President, I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please do. Thank you very much.
Right. You're welcome.
Okay, so we've been at it for about an hour. So why don't we, if it would be okay with everyone, take a break for about 10 minutes and return at 10 before the hour.
Oh, I need
For the moderator, do we need to recall the roll or can we just restart the meeting for this? I mean, in person, it's pretty easy. You can see that everyone is there, but.
Exactly. I think it is a good practice to do a quick roll call after a meeting, just because, like you said, you can't see people. And I'll go ahead and resume the recording.
Okay, thank you. So, Julie, could you?
Is being recorded.
Julie, could you recall the roll as we return from our break? Julie or Rosanna, could you recall the roll so that we can return from our break?
Hi, this is Julie. So, Charles Alexander.
Present.
Juan Armenta.
Present.
Jennifer Carlquist.
Present.
Sonia Early.
Present.
Jed Grant. Jed Grant.
Present. Sorry, I had a mute button problem there. I'm present. I'm here.
Randy Huggins.
Well, our whole thing is
Here. Hawkins here.
Okay. Diego Inzunza.
Present. Like you can just send it in. It don't ask you specifically what to give you, and then we'll look at it.
Did we have Diego? I didn't catch his. We did. Yeah. Okay. So we did. How about Mr. Armenta? I think he has joined us.
Yes.
Okay. All right. So everyone is present, correct?
Yes.
Okay, great. Thank you. We'll proceed now with, we'll do item number 8, Department of Consumer Affairs update, and then the budget update, and then we will go back to item number 6 after that. So with that, on to item number 8, the DCA update.
Good morning, Board President Grant and members. It's a pleasure to be here with you today. I'm Carrie Holmes, Deputy Director for Board and Bureau Relations at the Department of Consumer Affairs. Thank you for inviting me again to provide a department update to the Physician Assistant Board. I'd like to welcome Diego Inzunza and Dr. Hawkins as the newest members of the board. Congratulations on your appointments and thank you for your willingness to serve. I'd also like to congratulate your 3 reappointed members. members Alexander, Carlquist, and Early. Thank you so much for your ongoing service. One of my top priorities here at Board and Bureau Relations is appointments, and so I'd like to provide a brief overview of your board. According to the Physician Assistant Practice Act, the board consists of 9 members who serve 4-year terms and may be reappointed. However, as set forth in Business and Professions Code Section 3505, the board is currently comprised of 1 physician and surgeon, 5 licensed physician's assistants, and 4 public members, so a total of 10. The governor is responsible for appointing the licensed members and 2 public members. The Speaker of the Assembly and the Senate Rules Committee each appoint 1 public member as well. Currently, the board has 3 vacancies, 2 public members appointed by the Senate and governor, and a licensee member appointed by the governor. DCA and all the appointing authorities share the goal of a fully seated, diverse, and effective board. Filling current and upcoming vacancies is a priority. That being said, if any members know any great candidates, or if any members of the public attending the meeting are interested in getting involved, please find the link titled Board Member Resources on DCA's homepage to apply for an appointment. Our work continues even though COVID-19 has changed the way we do business now and in the future. Shortly before their last meeting, DCA and its boards and bureaus had just reopened offices to the public after a temporary closure due to the state and local stay-at-home orders to prevent the spread of COVID-19. DCA offices remain open with preventative measures to safeguard the health and safety of our employees and visitors. DCA continues to partner with the Governor's Office and Business Consumer Services and Housing Agency on statewide efforts related to awareness and enforcement of public health measures. DCA would like to thank the board and staff for your continued service during this challenging time. Thank you again for inviting me to your meeting. I look forward to the day when we can meet in person. If you have any questions or need anything from DCA, please don't hesitate to reach out. This concludes my presentation, and I'll turn it back over to Board President Grant.
Thank you, Carrie, and thank you for being here and for your help with appointments. You must be very busy right now. Crazy times for all of us. Just out of curiosity, more than anything else, do you have any idea when we might anticipate returning to in-person meetings?
I don't at this point. So for now, the executive orders that affected the Bagley-Keene Open Meeting Act will be in place until the state of emergency is lifted. So there's really no way to know when that will happen. I'm hoping that, and I would assume that the boards will have sufficient notice to reschedule, but I don't expect it to be very soon, but we just won't know yet.
Okay, great. Thank you.
No problem.
Any other questions for Carrie from the board? Great. Any public comment on the Department of Consumer Affairs report?
Thank you, Mr. Board President. This is the moderator, and I have opened up the Q&A panel. So if any member of the public would like to make a comment, please type, "I would like to make a comment," using the field in the lower right-hand corner of your screen, and submit it to all panelists. We are displaying instructions. All right, this is the moderator. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, thank you. And thank you again, Carrie, for your report. We'll move on now to item number 9, the budget update.
Good morning. My name is Marie Reyes, and I am the current DCA budget analyst for the Physician Assistant Board. First off, let me express my appreciation to President Grant for his service, and I'd like to welcome your 2 new board members, Randy Hawkins and David Izunza. On page 68 of your packet, you will see the current fund condition for the program. In looking at this, the board is really in good fiscal condition. The very first part of the fund condition would be the revenue and transfers that had occurred in 1920. For 1920, the revenue projection was at 2.3 million. The board did bring in 2.33. And so by the end of the fiscal year, you ended up with 19.4 months of reserves. Are you guys following me? That's on the very first column of the revenue report on page 68.
Yep, we see that. Thank you, Marie. Please proceed.
Okay. Yes. And then for this current fiscal year, we're estimating revenue to be at 2.4 million. Historically, since I've been the board's budget analyst, every year the projection, it always seemed to be the actual collection of revenue has always been like 5 to 8% more. The board has been very conservative in their projections. So I anticipate this 2.4 for this fiscal year to be higher despite of the pandemic. Because even last year with the COVID, you still managed to bring in 5% more in revenue. On page 69.
Marie, before you go on from that,
Yes,
I look at the projections for budget year 21, 22, and 22, 23 that they are a little bit lower. Is that, can you help me understand that?
For the revenue projection?
Yes, ma'am.
Yes, and that's because of what we anticipate on the income surplus. Last year, a payment of 1.5 million was done to the board, and so that's the reason for the higher. And the reserve, that's based on what the reserve is. The difference is on that surplus, the income surplus investment, the SMIF.
Okay, all right, thank you for that. I appreciate that.
Yeah. You see, on the next slide, page 69, is what the revenue breakdown is. And thank you, Rosanna, for pulling this for me. Let me see this one. It shows the breakdown of what's coming in for the board. As you can see, as I've indicated, the revenue, it was anticipated that 2.2 would come in, but 2.330967 came in. Okay. The next slide would be the breakdown of the expenditure for 1920. The board was very fiscally responsible that they were able to revert 207,000 last year. On Stan, it's always been like historically, since I've taken over the board last 2 years or 3 years ago, it's been like 15 to 18,000. But this year, you were able to revert 207,000. The board is in really good condition based on the information that we have. Any questions?
This is Jed Grant. I just am curious how we reverted so much. Was that due to people like staff leaving and then not quite being replaced yet? Is that where we saved all that money? Just curious where we saved an extra 180,000 or so.
For the for last fiscal year, you were at full staff. Because if I'm not mistaken, Lynn and Anita didn't leave until August. The report that you're looking at is for 1920, which ended up June 30th. The majority of the savings that I saw was basically on the general expenses. There's lesser travel that was done last year, likely because of the pandemic. Let me see. I'm looking at it. And then there's some external, even the attorney, your AG cost has gone down as well. So those are where most of that money came from.
Okay, and as we continue
and even
to
in general expenses. Go ahead, sir.
Oh, I was just going to say that as we add some staff, that we might and take on more of our in-house processing, we might expect some of those expenses to go up as we're adding staff. Is that correct?
Well, that is correct. However, your budget for this year has increased as well. So I do project your board to revert about the same amount next year. You've been fiscally responsible. I think this is one of the programs or boards that I've handled where they look at their expenses and expenditures very carefully.
Okay, thank you.
Any questions?
All right, hearing no questions from the board members, is there any public questions or comment on the budget?
Thank you, Mr. Board President. This is the moderator, and I have opened up the Q&A panel. So if any member of the public would like to make a comment, please type, "I would like to make a comment," and submit it to all panelists using the field in the lower right-hand corner of your screen. We are displaying instructions. This is the moderator. I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please. Thank you for doing that. And thank you, Marie, for your good reporting and informative report as always. Next, of course, thanks for being here. Next, we will move on to item number 6, the nomination and election of PA board officers. And Rosanna.
Business and Professions Code Section 3509.5 states, the board shall elect annually a president and a vice president from among its members. Typically, the nomination and election of board officers is held at the last meeting of the year. Do I have a nomination for board president for 2021?
Yeah, this is Jed. I'd like to nominate Juan Armenta as president.
Juan, do you accept the nomination for board president?
Is there a second? Is there a second?
I'll do it.
This is Charles. I'll second that.
And now on, if you accept or reject the nomination.
I was prepared to accept it, but Jed, I think I need to point out, I just looked, my term expires January of 2021.
If I understand correctly, Juan, the last year, you have one grace year that you would still be on the board. So you would still be on the board until December of 21, if I understand correctly.
Well, yes, that's correct, as you can serve for up to a year after your term has expired. I guess it is somewhat dependent on one factor, and that is if the governor were to replace Juan during that grace year, which is his option. So I guess that's a consideration. And of course, if that happened, we could elect a new president. So I think there's still a nomination that's been seconded on the table. But to answer the initial question, Juan would be able to serve for up to one additional grace period year from the date his term expired, pending what I just said about the governor potentially replacing him.
Well, in that case, then I'd be happy and honored to accept. Thank you, Jed and Charles.
Any comment from board members? Any public comment on before the board takes a vote?
Thank you, Mr. Board President. I have opened the Q&A panel. If any members of the public wish to make a comment, please do so by indicating you would like to make a comment. This is the moderator. I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's done.
Thank you. And Julie, could you call the vote?
Yes. Charles Alexander?
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Ed Grant,
Aye.
Diego Inzunza.
Aye.
Okay, the votes are unanimous. So effective 1 January 2021, Juan Armenta will be the president of the PA board. Anyone want to make nominations for vice president?
This is Charles. I'd like to nominate Sonia Early as vice president.
Is there a second?
This is Jen. Second.
Further comments from the board members?
Jed, I know you're going on deployment. Are you capable of serving as vice president while on deployment, or is that part of our issues?
Yeah, that's correct. I will be out of the country from mid-February through the end of the year for a military deployment. So that's part of the issue. Certainly, any board member can serve in these offices. I am not sure how much reliable internet access I will have during that time, but I think I'm always happy to, I know I'll have access to email, and I'm happy to assist however I can while I'm gone.
Okay. All right. Thank you.
Sure. Further comment from board members?
And we can have potentially more than one nomination. I think we should vote on one at a time, but if there are other nominations, we can entertain those now as well.
Well, this is Juan Armenta, and I think I would also nominate Jed as vice president, simply for continuity and a little bit of selfishness too. I'd like to lean on someone who's already done this job. So, but certainly no disrespect to Sonia, who I know has been doing this quite some time too. So I'm sure she's perfectly capable.
None taken. Thank you so much.
Thank you, Sonia. I think you know where I'm coming from on this.
Yes.
Okay. Any seconds for Juan's nomination? Okay, hearing no seconds, then that nomination will fail. So is there any further board comment on Sonia's nomination for vice president?
Hey, Jed, didn't Charles Alexander second the nomination for Juan Armenta? Did I miss that?
I didn't hear that. If was that the case, Julie, can you tell us what nominations are out there with seconds?
This is Rosanna. So we have a nomination for board president, Juan Armenta, seconded by Charles. And then we have a nomination for vice president. First is Sonia Early, seconded by, Sonia Early, seconded by, I didn't get that one, sorry.
Jen, I think.
Jed.
No, Jennifer.
And Jennifer Carlquist.
Yeah. And then I hadn't heard, this is Will, I hadn't heard a second yet for Jed's nomination for VP, but it's still technically on the table if someone wishes to. For the president, we already did take a vote, so that's already done. And that's Juan. Congratulations, Juan.
Yeah, congratulations, Juan. And that vote was unanimous if you didn't catch that.
Thank you.
Yeah. Okay, so if I understand correctly, just due to some of the communications limitations that we're having here, currently on the table, there is Sonia has been nominated to serve as the vice president, which was nominated by Charles and seconded by Jennifer. And I was nominated by Juan, and there has been no second. Would anyone like to make a second, or do we just want to, if there is no second on my nomination, then the nomination will fail. If there is a second, then we'll vote on both. So if there is no second, then we can take me off the list and we'll just vote on Sonia. Or if there are other people who would like to nominate board members for vice president.
Can we move that nominations be closed?
You could remove your motion or modify it.
No, I was speaking to the lack of a second for Jed.
Okay, so if there's no second, hearing no second, then the motion would fail if there's no second for the motion.
That's right.
So then that motion, since there is no second, that motion fails. And the only motion on the table is for Sonia. If there's no further comment, we can call the vote.
Yeah, I would say if there's no further nominations or comments, then we should vote on Sonia's nomination for vice president.
So hearing no...
And I think, Sonia, you accepted, right? I'm not sure if I heard you.
I humbly accept.
Okay, good.
Okay, so hearing no further comments, nominations, or seconds, the motion for me as vice president has not gone forward due to lack of a second. And are there any other nominations for vice president? Hearing none and having a motion with a second, any further comment on Sonia for vice president of the board from the board members? Okay, any public comment before the board takes a vote?
Thank you, Mr. Board President. I will go ahead and open the Q&A feature. So the Q&A feature is now available. If you would like to make a comment, please type, "I would like to make a comment," and submit it to all panelists using the field in the lower right-hand corner of your screen. We are displaying instructions. This is the moderator, and at this time, I see no request for public comment. Shall I close the Q&A panel?
Yes, please.
You're welcome. It's closed.
All right, so let's, Julie or Rosanna, whoever's doing it, can you call the vote, please?
Yes. Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza.
Aye.
Okay, the motion carries with unanimous vote. Congratulations, Sonia. You're the vice president of the PA board effective January 2021.
Thank you.
Of course. All right. So moving on. So let's see here. Next would be item number 10, which is approval of a passing score for 2021 PA initial licensing examination and the 2021 dates and locations for the initial examination. So this requirement is from Business and Professions 3517 is really an archaic portion of the code that we have drafted some legislation to try and get rid of. However, that legislation has not occurred. Those regulatory changes have not occurred. So we still have to vote every year on this. So the initial licensing examination is administered through the NCCPA, the National Commission on Certification of Physician Assistants, and it is administered at the Pearson View testing centers. And so we need two motions actually on this to be compliant with the law. The first one would really be on the passing score. And the motion would be to approve the passing score for the PA initial licensing examination. The name of that test is the PANCE, the PA National Certifying Examination, for the year 2021 as established by the NCCPA as the test that we require to establish minimum competency. If you have questions on the PANCE and how it is developed and scored, there is information on page 73 of the packet about that, as well as the NCCPA website has pretty extensive information on this. Every state in the country uses the NCCPA examination, to my knowledge, uses the NCCPA examination for the initial test of minimum competency for PAs. And so would need a motion from a board member to approve the PANCE as the initial examination, as well as the score established by the NCCPA as the minimum passing score for the score required. Is there a motion?
Yes, this is Juan Armenta. I'll make that motion to approve both of those suggestions.
Okay, so hearing Mr. Armenta making the motion to approve the passing score and Sonia seconding, any further comment from board members? Okay, before we vote on that motion, we'll also, because there's another part of this, we'll discuss both before we vote and have public comment on both before we vote. The second part of it is to approve the dates and locations for examination. So the NCCPA gives this examination on a year-round basis, with the exception of a few weeks in December between the 19th and 31st. And it is done at Pearson View testing centers. So a motion for the dates and locations of testing would be to approve the dates and locations as established at Pearson View testing centers by the NCCPA.
I'll go ahead and make that motion to approve those dates and locations. This is Juan Armenta.
I second.
Okay, also the motion was made by Mr. Armenta and seconded by Ms. Ehrlich. Further comments from board members? Okay, any public comment on these motions?
Thank you, Mr. Board President. I have opened up the Q&A panel. If any member of the public would like to make a comment, please type "I would like to make a comment" and submit it to all panelists using the field in the lower right-hand corner of your screen. We are displaying instructions for your reference. This is the moderator. I see no request for public comment. Shall I close the Q&A panel?
Yes, please.
All right, it's closed.
Thank you for your help. Okay, Julie or Rosanna, will you call the vote on these two motions, please?
Sure. Charles Alexander.
We probably, sorry to interrupt, just for technicality purposes, we probably ought to have two separate votes.
Okay, so the first vote will be on the passing score for the examination.
Charles Alexander.
Aye.
Juan Armenta.
Aye.
Jennifer Carlquist.
Aye.
Sonia Early.
Aye.
Ed Grant.
Aye.
Diego Inzunza.
Aye.
Okay, motion carries with a unanimous vote. Julie, if you could call the vote on the second portion of the motion, which is the dates and locations for examination.
Charles Alexander.
Aye.
Juan Armenta.
Aye.
Jennifer Carlquist. Jennifer Carlquist.
Aye.
Sonia Early? I didn't hear Sonia Early.
Aye.
Thank you. Chad Grant?
Aye.
Diego Inzunza?
Aye.
Okay, motion carries. So the National Certifying Examination by NCCPA, the PANTS, will be the test, and it will be on the dates and times as noted on their website at the Pearson VUE Testing Centers for the year of 2021. Thanks, everybody, for your help on that. Next up on the agenda is scheduling of board meetings and dates, item number 11. So typically we have quarterly board meetings, and usually they are held in person. There is a requirement to do one board meeting in Southern California, although we could do that particular meeting remotely as well. And we don't know for how long we will continue to have remote versus in-person meetings. And so I would just keep that in mind. Board staff has suggested some proposed meeting dates for February 8th, 2021, remembering that we don't want to go more than 100 days between meetings because we have problems with response times for stipulated agreements and things like that. So the first proposed date is Monday, February 8th, 2021, which is 91 days from today. And the second proposed date is May 10th, 2021, which is 91 days from the meeting before. The third proposed date is August 9th. And then the final proposed date is November 8th. So if we all have our calendars open, if everyone can take a look, let's just go date by date, and then maybe we can adjust each one if we need to, and then we can take a motion and vote on the dates as long as they work for everybody. So on Monday, February 8th, does anyone have any conflict on that day? Okay, hearing none. The next date would be Monday, May 10th. And I will just note that I will be out of the country for the final 3 dates here, but that I will try and attend the meeting remotely if possible. Does anybody have any concerns about May 10th? And next one is Monday, August 9th. Just something to think about. Often school is starting in early August. I'm not sure if anybody has those dates yet. Sometimes it's challenging to get to a board meeting if it's the first day of school for your kids. And then finally, Monday, November 8th. Okay. Hearing no concerns from the board members on any of those dates. Is there any public comment on those dates? Knowing that CAPA typically likes to attend our meetings, want to make sure they have the opportunity to comment on the dates.
Thank you, Mr. Board President. I have opened up the Q&A panel. If anyone would like to make a comment, please type, "I would like to make a comment," and submit it to all panelists. We are displaying instructions for your reference. All right, we have an individual identified as Ed Howard that would like to make a comment. Ed, if you can please keep your comment to 3 minutes, I'll give you a 30-second warning. And Ed, you have been unmuted.
Thank you. Just a quick thank you to President Grant and the board for seeking our input on the meetings. The meeting dates look great. And again, thanking you for your consideration.
All right, this is the moderator, and that was the end of our request for public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Okay, thank you. So do we have a motion and a second to accept the meeting dates as previously discussed for year 2021?
Jed, before they make the motion, can I make a quick clarification / question to the board members? So the item is listed as also, the agenda item is listed as discussion and possible action on meeting dates and locations. I think it sounds like we mostly discussed the dates, and I think it's fair to say that we don't really know with much certainty what locations are going to kind of look like in 2021. So it sounds like, is it the board's intention that we are kind of punting for now on the location selection? Because I haven't heard us discussing specific cities or schools, and pending the outcome of the pandemic, the state of emergency, potentially at our next meeting, we can set those if we're going to have those in person at other locations, but kind of plan on tentatively having the rest of our meetings via WebEx until further notice. Is that the intention?
I think the intention is to set the dates, understanding that they're going to be remote until further notice, and then at a future meeting, once we no longer are required to be remote, then we can set locations. Just historically, all of the meetings except one per year have been in Sacramento, and then we have one meeting typically in the summer in Southern California. But for now, when Ms. Holmes addressed us from DCA, it sounded like for the foreseeable future, we'll be having remote meetings.
Okay, so, thanks for the clarification.
Sure. I'm sorry I wasn't clear the first time. I should have clarified that a little better. So we're setting the dates, locations for the current time would be remote as required by DCA until such time as the emergency orders have been lifted, when we will then need to, maybe we should make the motion say that the first meeting after the lifting will be in Sacramento, and then further locations will be determined at that meeting. So looking for a motion to accept these dates, with the first in-person meeting being in Sacramento once the emergency orders are lifted, and further locations determined at that meeting.
This is Juan Armenta. Will make precisely that motion. Thank you.
Looking for a second on the motion?
This is Jen. I will second.
Okay, so
thanks. And this is Will. Just another helpful tip for our new members. If when Jed or anyone, even the executive officer or myself, the board counsel, kind of describes that motion like Jed just did very accurately and in detail, to save yourself the trouble of trying to replicate the words that Jed just said. You can kind of like Juan just exemplified, you can say so moved, or I make the motion as described by the executive officer or by the president. That way you can also get involved right away making motions without having to verbatim describe what someone just said that you agree with.
Thanks, Will, for that clarification. Any further comments by board members before we take the vote? Okay, Julie, will you call the roll, please? I'm sorry, Juan, did you have a comment?
No, I'm sorry.
Okay. Julie, can you call the roll, please?
Sure. Charles Alexander.
Aye.
Juan Armenta.
Aye.
Jennifer Carlquist.
Aye.
Sonia Early.
Aye.
Jed Grant.
Aye.
Diego Inzunza.
Aye.
Excellent. So those dates will be set for the meetings for the year of 2021. The motion carries unanimously. Thanks, everybody. And unfortunately, we will be doing them via WebEx until we don't have an emergency pandemic anymore. Let's see. It's been about an hour. Does anyone want to take a break, or do we want to just push through for maybe another hour and then take lunch?
Let's push through.
Let's push through. Does anyone need a break? Okay, hearing none, we'll continue forward. So that was item 11. Moving on to item 12, discussion and possible action regarding hearings pursuant to Business and Professions Code 3530 for petition for reinstatement of license or modification of penalty. So this actually, Will, maybe I should let you take this one in terms of describing it, kind of what we're wanting to do here.
Yeah, sure. Can you hear me? I just had a mute issue there.
Yeah, yep, we can hear you.
Okay. So under Business and Professions Code 3530, Section 3530, we're looking at C, subdivision C in particular. But this section talks about the board's rights and responsibilities regarding when a licensee issues us a petition for reinstatement of a license that's been revoked or a modification of the penalty that the discipline that they're serving. And currently, my understanding is when we receive such a petition, we generally have an administrative law judge from outside our agency, from inside the Office of Administrative Hearings, come and hear that petition before the board in a board meeting, and then subsequently the board will meet in closed session with the administrative law judge and myself and board counsel to kind of discuss what they want to do about that petition, whether they want to grant it, whether they want to deny it, etc. But Section 3530C, and I'll just read it because it's very short, says the petition may be heard by the board, which is what we do. And then it says the board may assign the petition to an administrative law judge designated in Section 11371 of the Government Code. After a hearing on the petition, the administrative law judge shall provide a proposed decision to the board that shall be acted on in accordance with the Administrative Procedure Act. So my understanding of this, my reading of this, and what I'm recommending to the board is you have two options under this section. Currently, we've kind of been doing the primary option of hearing the petition ourselves with the assistance of the administrative law judge, but it does give us the option as well to basically refer it out to the administrative law judge to conduct their hearing separate of the board meeting, and then the judge will issue us a proposed decision upon which we need to vote. So there are some kind of, I would say practical positives and negatives to either approach, and maybe Jed and Rosanna and other board members can comment on what those might be. But there's one advantage that I see of hearing the petitioner and his or her attorney, as the case may be, before you can take a look at them, you can hear their tone of voice, you can decide whether they're telling the truth or not, whether they're truly showing contrition for their past bad behavior or not. That's one advantage, I think, of hearing the petition yourselves. And if you just have the administrative law judge do it, you may not have that opportunity. Of course, the judge will make findings. The judge will say things like, I found this petitioner trustworthy or truthful or contrite or the opposite. And you can rely on that, but it's not quite the same as laying your eyes on them. The other practical, I guess, implication that other folks can touch on more is just the kind of time and constraints that we only have so many board meetings, we only have so much time per meeting. They do take up a lot of time, these petition hearings, so there's that consideration as well. And I'm sure I'm forgetting some aspect of it that perhaps Jed and Rosanna can weigh in, and then if you have any further questions, I'm happy to explain those. But basically, what we're looking for from the board today is a discussion of the relative pros and cons of the two approaches, and so a motion to basically direct staff to proceed with one or the other approach going forward.
Thanks, Will. That was good explanation. So basically, we have always, well, at least since I've been on the board in 2013, we have had, and I think it was sort of historically something that had been done well before that in my talking with the prior board president. All of the hearings and everything had been done by an ALJ, and then we would take a proposed decision, and then we would vote on the proposed decision. And if we reject the proposed decision, then we would set it for a hearing for us. But on the petition for reinstatement or for early termination of probation, the board members sort of felt like they wanted to have eyes on the petitioner and have an opportunity to directly interact with them. So for Diego, and I think this process is the same, Dr. Hawkins, at the medical board, but basically what happens is if a licensee has had their license disciplined in some way, they can petition for early termination of their probation, the conditions that were placed on their license as a result of their misconduct, or if their license has been revoked, then they can petition to have their license reinstated. And so, like Will said, they would come in and the administrative law judge is there, and you have the Attorney General's office has a representative, and then the petitioner often has counsel or represents themselves, and there's witnesses, and it takes the better part of a day to do this. So the thought is, if we send this out to a hearing with the administrative law judge and get a proposed decision, just like we do on everything else, we might save some time. And as we have increasing numbers of licensees with increasing numbers of people on probation or revoked or surrendered, then the potential becomes that we're having more of these hearings, which are costly and in terms of both money and time. So it doesn't take away our ability to, if we're not happy with the proposed decision, to reject it and set the matter for our hearing. It just adds an extra step where we can have the judge go through the case and make a proposed decision that we can either then accept or reject, rather than having that occur in front of us, is the big difference. And by not having it occur in front of us, we save time and money, but do not lose the option to have that happen. If we do have it occur in front of us, we may end up having to have either more meetings or 2-day meetings as we have more of these come forward. And what really made it stand out is that this is the only time we do it this way. Every other time we send it off and let an ALJ make a proposed decision. So the question is, well, why are we doing it different for these reinstatements? And I understand the historical reasons, but as the licensed population has grown, maybe it's a good idea to just do this the same way we do everything else. So with that, I will leave it to the board if they have any questions or comments. And then if someone wants to make a motion to basically have the staff make this a process internally that we have decided we want to set these for hearing with, or we don't want to set these for hearing in front of the board, that they can be sent off to a law judge.
May I speak? I have my hand up. Dr. Randy Hawkins.
Yes, please do.
Yeah, for better or for worse, the panel receives a proposed decision from the judge, and we vote to accept or not. We don't have the physician individual come before the board. It would really extend our time a lot if we had everyone come before us. That's just our way, for better or for worse.
Thanks, Dr. Hawkins. Yeah, I think, when we only had, 4,000, 5,000 licensees, it was not particularly onerous, but with 14, 15,000 licensees, we'll start to have more and more of these hearings, and it's just not super practical to do it this way. So thank you for your input. Any further comment from board members? Okay, so hearing no further comment from board members, looking for a motion to direct board staff to set all petitions for reinstatement or early termination of probation to initially be heard by an administrative law judge rather than an in-person hearing.
This is Juan Armenta. I'll go ahead and make the motion as described by President Grant.
This is Jen. I'll second.
Go ahead, Jen.
Okay. Any further comment from board members? Hearing none, any public comment before the board takes a vote?
Thank you, Mr. Board President. I will open the Q&A panel. The Q&A panel is now available. If you would like to make a comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and submit it to all panelists. We'll give you a moment to access the feature. This is the moderator. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Further comment from board members before we vote? Okay, hearing none. Julie, will you please call the vote?
Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza.
Aye.
Great. Okay, the motion carries unanimously. Thank you, everyone, for your input. The next item on the agenda is a report on item number 13, which is a report on medical board activities, and that will be from Dr. Hawkins.
Thank you very much. I will be brief. This is my first meeting on the Physician Assistant Board. I want to advise you that I actually volunteered for this board 2 years ago. I'm not sure exactly why it never went beyond that, but I did volunteer. Also, I've worked for the past 35 years in my private practice with physician assistants, past and currently in my practice. And finally, in this regard, my wife for 35 years is a certified physician assistant in practice, working at Kaiser and for some at a fairly qualified program. The board last met August 13th and 14th of this year, and I bring greetings from the president, Denise Pines. We have a new executive director, William Prasiska. You all are probably aware that Kimberly Kirchmeyer was appointed to the DCA head, and William Prasiska replaced her as our new executive director. We also have a new executive deputy director, Raji Barhenji, and they all bring greetings. In a separate but related item, I sit on the board of the Health Professional Education Foundation. This is one of the boards that medical board members can sit on. There are two members that sit on that board. And in brief, Health Professional Education Foundation, also called HPF, mission is to provide loan forgiveness, scholarships to allied health nurses, advanced practice providers such as physician assistants and nurse practitioners, and physicians who agree to practice in underserved areas of California. HPF has one scholarship program that physician assistants are eligible for, although others exist. This is the only one that we actually select. It's called the Advanced Practice Healthcare Scholarship Program. And the next application cycle opens January 4, 2021, something to pass on to physician assistants. Information can obtain about all HPF programs by querying oshped.ca.gov/HPF. That's oshpdca.gov/HPEF. And that's the end of my report.
Great. Thank you, Dr. Hawkins. And thank you for volunteering to serve on our board. I think it's really important that we have a member of the medical board on our board. Historically, physicians and PAs have very close relationship, and even though the board voted in its strategic plan to try and move to being a fully independent board, I do think it's important that we maintain those close ties with our physician partners. So thanks very much for serving on our board, and thank you for your report. Any comments from the board members on Dr. Hawkins' report? Okay, any public comment on the medical board report from Dr. Hawkins?
Thank you, Mr. Board President. I have opened up the Q&A panel. If anyone would like to make a public comment, please type "I would like to make a comment" in the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions for your reference. This is the moderator. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
All right, it's closed.
All right, thank you. So before we go, the next item on the agenda is regulations. But before we do that, I would like to maybe, we do have a legislative committee, so moving to number 18 on the agenda. At the last meeting, we talked about the need for a second member on the legislative committee. Right now, Sonia has been shouldering that all herself since Mary left the board. And so we talked about that last meeting, but we didn't have an agenda item. So what we need to do this meeting is have someone nominate a person to serve on the legislative committee, and then that there's no term for this. The legislative subcommittee basically looks at the legislation coming in terms of how it affects PA practice or our board, and then reports to the board on that and gives the board an opportunity to take a position on legislation. So there's a fair amount of work here that occurs outside the meetings. I think one board member expressed some interest in doing that last meeting. So I will make the nomination to have Jennifer Carlquist sit on the legislative committee. And although I can appoint her as a board president, I think it's a little cleaner if we have the board second and vote on that.
I'll second. This is Sonia.
Okay. You want some help, Sonia?
I would love to have Jen help.
All right. Jennifer, do you accept that nomination?
I sure do. Thank you, Jed.
Okay. So any further comments by board members? Are there any other nominations for the committee? Okay. Hearing none. Will, I don't think we need a public comment on this, do we?
Technically, it's on the agenda. The agenda says we'll take public comment on every item, so there's certainly no harm in letting people comment if they have any comments.
Kind of cut off there, but my understanding is since it's on the agenda, we should. So
that's right. That's the summary.
Okay, good. So then before the board votes on this, is there any public comment on the nomination of Jennifer Carlquist to the legislative subcommittee?
Thank you, Mr. Board President. I have opened up the Q&A panel, so if anyone would like to make a comment, please indicate that you would like to. This is the moderator, and I see no request for public comment at this time. Shall I close the Q&A panel?
Yes, please.
All right, it's closed.
Thank you. Any further comment on the board members before we vote? Okay, hearing none. Julie, will you call the roll, please?
Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist.
Aye.
Barely heard you, but I think it did. Sonia Early.
Aye.
Jed Grant.
Aye.
Diego Nzunza.
Aye.
Okay, the motion passes unanimously. Congratulations, Jennifer. You are now on the legislative committee. of the PA board. So I look forward to hearing your input on the various bills and stuff that's going on in the legislature.
Thank you, Jed.
We will do the Education and Workforce Subcommittee report. I will do that. Let's see, item 17. So we still have some significant growth in this is going to be, let's see, page 79 of the packet for the public members. So there are about 260, I think now 264 PA programs in the United States with almost 50 under development, and these numbers change fairly frequently. This is as of, let's see, 26th of October was when this was put together. So the numbers are always changing a little bit. We currently have 16 accredited PA programs in California. The colors denote where they are. So the vast majority of the programs are in the Los Angeles and San Diego area in Southern California. There are 4 in the Bay Area, 2 in the Sacramento or Central Valley area, and 1 on the Central Coast. If you look at this report, it basically, if it says developing, that means that they are not quite taking students yet. If it says provisional, that means that the school is within 5 years of operation, of beginning operation. So provisional status for the first 5 years that the program is operational. And then if there's nothing behind it after the name of the school, that means that they have continuing accreditation. So in looking at this, you can see that more than half of the PA programs in California are provisional, which means they're new within the last 5 years. And we have several developing programs that are coming. The number of students, some of this is taken from their websites. However, if there isn't a number listed on their website, then the national average of 45 is used, which gives us an in-program, an in-state number of graduates every year at around 1,064. And so right now we only have about 884. This just reflects the continuing growth of PA programs in California. And I think we're likely to even maybe continue to see a little more growth in programs in California since it's such a big state and we had a relatively few number of schools, more than doubling our schools in the last 5 years that have PA programs. One thing to be aware of is that PA training, it models medical school. So the first year is didactic, and the second year and third year is clinical. The average length of a PA program in California is 27 months. That's the same as nationwide. And those programs, the second and third year are out in clinics doing clinical rotations. And because of the pandemic, many of those clinical rotation sites have closed or are no longer taking students, which is causing significant difficulties for these PA training programs. And so some have gone to online alternatives and other things. That it isn't necessarily bad. The accrediting body is watching this closely and making sure that the standards are still being met. However, it is something I think for the board to be aware of is that the training has changed a little bit because of the pandemic, because of things going on there. And then, of course, the cost of training, if they have to be there longer to meet their requirements, goes up a little bit as well. So just some update there. This is sort of the same update we've been doing for quite some time. Just looking at the growth that's occurring here in our state. We have large numbers. I work at a PA program. I think we just closed our cycle this year. We had like 2,700 applicants for 45 seats. So it's still very competitive to get into PA school. But lots of PAs graduating and coming to work. And these numbers that you see on this report don't include out-of-state applicants. So this is part of the reason that we have tried to increase our board staff a little bit based on the increasing numbers of applications, and seeing that as these developing provisional programs, well, especially developing programs, come online, we're likely to see quite a few more graduates and licensees. And so, being prepared for that as we can sort of see it coming in development. So happy to answer any questions or entertain public comment. Dr. Hawkins, yes.
I'm sorry, no, nothing for me.
Oh, okay. I thought I saw your hand on the thing there. So any other comments from board members on the education and workforce report? Okay, very good. Hearing none, we will move on. So the next item to cover on the agenda is the regulations report. And this will be from Karen, where we're at on our regulations.
Good morning. I hope I can be heard. And if I start to go in and out, somebody tell me, speak up. On the regulations, there's an attachment in the meeting materials, which is, sorry, it's awfully small print, but I want to go following that attachment. The first regulation package is the AB 2138 implementation package that is with the Office of Administrative Law, and the reviewer at OAL asked us to make certain language changes, most of them considered non-substantial, to do it in a 15-day notice so that the public could see the language changes and the board could vote to accept or reject the requested language. Basically, OAL is trying to standardize all of these packages because there were approximately 38 of them coming from the Department of Consumer Affairs. And so now they're trying to make sure, as the different packages come in from the different programs, that they are consistent. And so there have been a number of, if you happen to look at other boards, 15-day language modifications that have been requested at this stage of the game. And I understand from speaking with Julie that our 15-day for the physician assistant board modification of text ran from the 21st of October to the 5th of November, and there were no comments. So if the board votes to accept the modified language, which was requested by the Office of Administrative Law Reviewer, and then staff can go ahead and prepare the final documents, and that regulation is much closer to being finally implemented. Yes, it is this blue, light blue and white chart that has very tiny writing. And so as to this first of the regulation packages, it would be up to the board to vote to accept the modified text that the Office of Administrative Law asked to be sent out and adopt that as the final language for this package, and instruct staff to finish preparing the final document to promulgate the rulemaking.
Karen, this is Jed. I might have missed it in the packet, but I didn't see that language in the packet.
Ah, okay. It's on the website.
Did I miss it? Rosanna, is it in the packet? If it is, could you direct me to the page number?
I don't think it is, Jed. I don't think you missed it.
Okay.
Because I don't see it either. And I was busy focused on trying to get the little details into the chart for all of the regulations.
Okay, if I would like to be able to take a motion and vote to approve this today, but we would need to see the language.
Yes.
Would it be possible after lunch or at some point today before we go into closed session at the end of the day to maybe pull that up on the screen, asking the moderator if we could get that up there so we could look at it and take a vote on it?
Yes, I'll send it over to Tricia.
Tricia, is that something that we could do?
Hi, this is the moderator. Yes. If I get that in email, I can save that on my screen and then load it up.
Perfect. Karen, would you be able to direct her where to go to put that up there for us so we can vote on that? We don't want it to go stale between now and the next meeting.
Yes, yes.
Okay.
And
Great.
actually,
Sorry.
yeah, no problem. That to me, this is my error. It should have been a part of the meeting materials, and I missed that. Rosanna did a great job of getting the request that we got from OAL and the modified text sent out for public comment quickly to get it done before the meeting. So this is my mistake. Okay, so I'm going to move to the next item. And Rosanna, I think it was published on the website. So
yes, I'm sending the link right now.
Okay, all right. Jen said make sure that I told you where it was, and I was like, she knows, man. She was on top of it. Okay. All right. The next item there on this list we have is the required actions against registered sex offenders. And that initial package, which has not yet gone out for notice, the first 45-day comment period, it has gone through legal, through budget, through the director's office, and it went to agency on the 8th of October. So we would be expecting it to come out of agency fairly soon, and then it can be published in the notice register and for the 45-day public comment period. So that particular package is in its initial stages, but it's very close to being able to be published with the Office of Administrative Law. And at the time of writing the initial statement of reasons, there wasn't a lot of feedback expected on that regulation, but we will see. The next regulation is the renewal of license and continuing medical education. It's been entirely worked through by legal, and what we're waiting on is budget. And that is the same situation for the continuing medical education implicit bias curriculum, approved by legal, waiting on budget. During the last 9 months since the beginning of the year, the Department of Finance has made 2 changes to what they want on regulation packages. And that has meant that every regulation package for every Department of Consumer Affairs program has had to have a review of its budget estimates and language. It used to be if an anticipated cost was approximately $50,000 or less, basically one position, maybe an AGPA position. If it was smaller than that, a program could report it in the regulatory documents as minor and absorbable. And the new philosophy is, if there's an expense, show us what it is. So budgets has been calculating expenses in the neighborhood of $15 a year over 5 years, that kind of thing. And so budgets is a little behind. At this moment, it is a bit of a pinch point, and they are working and getting a lot done. But these 2 packages are stuck there at this moment. And as soon as that's done, then it will be reviewed by the director and agency and can go out for publication. And then the last regulatory package to discuss was the scope of practice, the changes for the SB 697 requirements. And as noted, there isn't a regulations person at the board after that person retired at the end of August. And Rosanna and Julie have been dealing with these other packages and responding to questions and keeping these other things moving. But the language for this, the initial documents to be submitted to legal, I haven't gotten them. And I couldn't imagine that with the short staff they have, that they would be able to have these together. Will, we were talking about that there was language. I had said maybe we could do it in the regulation, and you were pretty clear, no, you don't have the statutory authority on that, on the 697 package. I know you wrote to Jed. Could you briefly explain to the rest of the board?
Yes.
last meeting, we approved the language to add to the regulation, but we, I guess, in our haste, and that was the one where we kind of took a break and came back with language right after the break to add the audit requirement, or the audit possibility authority, I guess I should say. And in our haste to do that, we didn't check the underlying statute, which basically limits those criteria for controlled substance education course providers to the regulations as they existed on a certain date. I don't have the date right in front of me. I'll pull it up. But so in essence, we can't change that until we change the statute. So we, of course, are going to pursue doing so in our sunset hearing, which was originally scheduled for March of this year and has just, as of last week, been rescheduled for later this month. So we're kind of working behind the scenes, Jed and Rosanna and I and Karen, to prepare a statement that would potentially give us the authority to actually change the controlled substance course provider regulations subsequent to the date that they provide. I believe it's January 1st, 2020. I'll pull it up here while I stop talking.
Yeah, I had not seen statutory language that freezes something with what the regulations were at a certain time. So this was a great education for me that sometimes I'm used to, the statutes follow behind the regulations, but this was actually a statute that says, no, keep it where the regulations were as of this date.
If I could just add some background related to that. When we were working on SB 697, there were multiple revisions, and one of them had that sort of sunset date on the regulations in there. And I think, if I recall correctly, we had agreed to have that removed, but somehow it ended up in the final version. And I think it was an error. Kappa may want to comment on that, but at any rate, we certainly can't adequately police the controlled substances providers with that freeze date in the Business and Professions Code. So once that is corrected, then we'll be able to have regulations that will allow us to a little better regulate the controlled substances courses.
Yeah, and I found this statute, this as well. I found it. It's Business and Professions Code 3502.1, subdivision E3, and it says that the board shall establish the requirements for satisfactory completion of this subdivision, evidence of completion of a course meeting the standards, including pharmacological content, established in our regulations, sections 1399.610 and 6.2, as those provisions read on June 7th, 2019. Shall be deemed to meet the requirements. So that's from the statute, and so under regulations we can't just deviate from that, from those provisions as they read on that date. So a little technicality there, but kind of the update and our plan to address it.
Karen, the rest of the SB 697 regulations that are listed here, what's the process on those? Like the rest of the regulatory change, I understand we couldn't change the one on controlled substances stuff, but the rest of them we should be able to move forward with, correct?
Yes, that staff would prepare. You could just take out the one that you're not going to change in the text, but they would need to prepare an initial statement of reasons that explains any of the choices the board made for each of the changes, and a notice to go out to the public in the notice register. And they submit those documents to me, and then I just proof them. We have budget weighed in on the changes, and it starts in that process. And I have not gotten any documents from staff because you guys are short-staffed.
Yeah, unfortunately, we had sort of an untimely retirement there. We did pull one of the regulations, the proposed language for it. We completely pulled that out and said we would rework it. because it was just kind of not consistent with the sort of the intent behind 697. But the rest of them were pretty good. So I'm wondering if it would be appropriate to move forward on the language that we sort of looked at last time, minus the two that we pulled out, the controlled substances, and then I think it was 545. I can't remember which one we said we didn't want to. We wanted to rework the language on last meeting.
Yeah.
Yeah, 545, I believe, and that's what Ed commented on, and I noticed his hand is raised. So perhaps we could take some public comment at some point here soon.
Yeah, before I'm sure Ed will have lots of comments here, which we welcome. But I just want to make sure we're kind of at least that I'm keeping this straight in my mind, and the other members are. So. Basically, this package has to do with making our regulations consistent with SB 697, which was a big rewrite of the PA Practice Act about a year ago. And we want to make sure that our regulations reflect the legislative intent of that law. And so that's what we're trying to do, is just be compliant with what the law says, so that we're doing what's in the law. So what we have here for suggested language, I think, is pretty good, with the exception of the two sections that we discussed that we wanted to pull out and rework the language. And so that's kind of where we are with this, if I'm understanding correctly. Is that correct, Karen?
That is correct. And I'm looking for that, what was the second section that we had the pullout on. And unfortunately, I'm looking in the minutes and not finding it right away.
I think it's 545.
Yeah, that's right.
Yeah, so I'm pretty sure it's 545. So it had to do with supervisory requirements and review of the practice agreement, and it was kind of bad. So I think that definitely needs some work. And the other ones, though, I think might be okay to just move forward with. So would it be possible to pull 545 and the controlled substance one out of this group, and then move forward with just those and send 545 later? Since the work has kind of been done on these, and if we're good with the language, which I think we were on the last, just pull the problem ones out and move forward with these ones that look okay. Is that something we could do?
Yes, and a good thing to do.
Okay.
You already had a vote to move forward with the package, but to have it clarified with those two out, that the rest should be a package that staff would prepare and submit and move forward with.
Oh, I see. Okay, I understand. So we've already voted for those to move forward. They're just because of the staff shortage at the board, that hasn't happened. Am I understanding correctly?
Yes.
Okay. All right. Great. Okay. Thank you for clarifying. I feel like I have a better handle on it now. Okay. Did that conclude your report, Karen?
Yes, sir.
Okay. Thank you. So any comment from board members, and then we'll open it up for public comment.
And I think we're fairly close, and can check with Madam Moderator, to having that website pulled up on the materials when you're ready, Jed, if we wanted to go back to the AB 2138 amendments. Tricia, do you have that ready?
This is a moderator, and yes, so I clicked on the link and it pulled up. It looks like the same thing we're looking at now, only it says with modified language. Is that what we want?
Yes.
Okay, so let me go ahead and share that then. Okay, so we should be seeing that now. Can everyone see the new document?
Yes.
Okay, perfect.
Karen, are you able to walk through the double strike-throughs and double underlines for folks, since this is the first time everyone's kind of seeing this?
Yeah, I was trying to pull up the website, so I'm working from the same one that you have. But I also have the last notice and modified text that I sent to Rosanna. So I just was pulling it up on my other computer so that I'm not trying to read from the very tiny. Okay.
Yeah. And it looks like we may need to move to, subsequent pages. So just let the moderator know which page it is you're looking at. Because I don't see any double underlines or strike throughs on page 1.
Okay. Yes. So for the proposed modified language on the front, what's added in is a description that modified text with initial text, you simply underline once for new, and you strike out with one line showing that it is being taken away. And when modified text is published, you leave what you had with the lines adding and striking out, and additional changes are indicated by a double underline or a double strikeout. And so the first thing you have at the proposed modified language is the explanation that the proposed changes, the modifications are in double underline and double strike through. And then we're looking with 1399, 5.25 substantial relationship criteria. And the first change we have with this, the change we had with this was down at the bottom. So it's on the next page in the portion known as the note. So it's the last thing written under the regulatory language. And that's mostly for attorneys and researchers to understand. There was a citation as an authority to Business and Professions Codes 493, and OAL has decided on these packages they don't want that as an authority and asked us to remove it. So that is double struck out. Then on to the next one, 1399.526, the rehabilitation criteria for denials and reinstatements. And that's on the same page, just after these run, they're not separated. The sections are not separated by pages. They're in a string. And so you would still be on page 2 of 4, not page 3 of 4. And for the 1399.526, thank you, the first strikeout is the language had read, when considering denial of a license under Section 480 of the Code on the ground that the applicant was convicted of a crime, the board shall consider whether the applicant has made showing of rehabilitation. And we had the phrase, and is presently eligible for a license. And OAL feels that is extraneous and asked it to be removed. And it doesn't change any of the board's powers to make these considerations and deny or accept. So that is struck out with double strikeout there. And then in the next sentence, let's see, I don't have to see it in any more double strikeout. The next change is down in subparagraph B, and the explanation, if subdivision A is inapplicable, these are people who have had a criminal conviction, and they're wanting all of this language in the many packages to be as clear as possible. And they felt if subdivision A is inapplicable, that's for the ordinary person, they're like, oh Lord, what does that mean? So what they're having us do is strike out that language and actually explain what that means, which is the added underline language, if the applicant has not completed the criminal sentence at issue without a violation of parole or probation, and then taking out or. The board, so that's explaining for the people, that's what if subdivision A is inapplicable means. And then just, we're striking out or, the board determines the applicant didn't make a showing, then other opportunities for the board to be considering. I have underlined here the new language, which is the denial is based on professional misconduct, or the denial is based on one or more of the grounds specified in these sections of the code. It's just making it clear to the applicant, these are the powers the board has to deny still. And unprofessional misconduct and these sections of the code are listed as statutory places where the board can deny a license or a reinstatement petition. And then let's see, what do we have next? Taking out the last sentence that says the board shall find, basically by adding that language in, OAL felt this additional language is confusing. And so they're editing to make all of them have this same structure and language. And so then the last sentence is removed, which is the board will find an applicant made a showing if they find he's someone, whoever he or she is rehabilitated on these grounds. That's still, we're considering now the items B 1, 2, 3, 4, 5, but without as lengthy an introductory paragraph. And the issue for the next change is in subdivision B1, OAL wants all the boards to use the term gravity versus severity. And
next page.
Yes, that's on to page 3. Thank you, Will. And then, so it's the nature and gravity of the acts. And what we're adding in is unprofessional conduct as defined in section 3527 of the code and section 1399.521.5. So these are a statute and a regulation which gives the board power to deny or revoke a license based on unprofessional conduct. And they wanted the citations in there so that it's not just a vague saying, unprofessional conduct. It's unprofessional conduct as defined in this statute and this regulation. And then professional misconduct. And so anywhere where the board is reserving certain power to be able to deny things, OAL said you need to put it in there so that it's very clear to the people who are trying to use this process. So then that addition of unprofessional conduct as defined in this section of the code and this section plus professional misconduct is added again in number 2, which is so they're considering the nature and gravity of any of these behaviors. Number 2, evidence of any of these behaviors committed after whatever the problem is, that is the point of the license either being considered to be denied or not be reinstated. So it's allowing the board to look at this behavior if it happens after they're already being investigated for some sort of criminal conviction that's related to unprofessional conduct or professional misconduct. So trying to keep a broad retention of authority for the board to be able to protect the public and make the decisions based on where they have this authority in the code and regulations. And then that same trifecta of unprofessional conduct as defined in the code and in the section and professional misconduct is again repeated in number 3. So it's saying the time elapsed since whatever it is, the unprofessional conduct or professional misconduct. So the first 3 all got changed to add those additional powers the board has. So it's the severity of the acts and did it involve unprofessional conduct or professional misconduct, the evidence of any such acts since the first set of acts, and the time elapsed since the initial set of acts. So then let's see, the only other revision on this one was to add as authority section 481, and all of the AB 2138 packages are adding Business and Profession Code section 481 as the citation for authority on the discussion of denials and revocations. And then on the last one, section 1399.527, the rehabilitation criteria for suspension or revocations. The first change, and that's still on the same page, the first is in subdivision A. It's again removing the phrase when it says the board shall consider whether the licensee has made a showing of rehabilitation, and taking out and is presently fit for a license. That was deemed by OAL to be repetitive and confusing. And then the next change on this is in the subdivision B for 1399.527. And again, as I explained above, they felt if subdivision A is inapplicable, that's going to be harder for someone who might be taking advantage of these rules to follow along. And so instead, we're adding the discussion, the license has not completed the criminal sentence at issue without a violation of parole or probation, and removing or the board determines they didn't make a showing of rehabilitation, and additional authority the board is keeping is that the suspension or revocation was based on a disciplinary action described in 141 of the code, or the suspension is based on one of the grounds specified in Business and Profession Code 3527, 3530, or 3531. Basically, anywhere in the code where the statute says the board can suspend or revoke a license, they wanted it cited specifically here so that a lay person trying to figure out this could look and see, oh, that's why the board could say no. And that's why they're listed here, to try to make that clearer. And again, as above, they take out the last sentence because at that point it's repetitive and makes it more confusing. And again, as above, for the changes in B1, switching from severity to gravity, because that's the term they want, and adding in disciplinary actions and unprofessional conduct. These are making sure that we are listing all of the matters that the board can consider. So for the A1, it's the nature and gravity of the acts, disciplinary actions, non-professional conducts or crimes. There's a change for page 3 in that we've added in disciplinary actions and unprofessional conduct as well as crimes. Before, it simply read acts or crimes. And well, I would think that's a big enough to take in disciplinary actions and unprofessional conduct. OAL is saying if you wish to be able to consider those, list them so that someone trying to use this understands what powers the board have. So that's the changes on 1 and on 3. And let's see, there was also a change in the authority citations to section 481 to be added in, so it's consistent with all the other AB 2138 packages.
Karen,
Yes.
are you on page 4 now?
Let's see, what did we get to?
I'm not following you at this particular.
Yeah, page
okay.
4. We need to switch to page 4 for the discussion of 1399527 when we move to B. And just like above, that was where they felt subdivision A is inapplicable. That's not clear enough, and so we had to add the longer language explaining the licensee hasn't completed the sentence at issue without a violation of parole or probation. Take out or, and then list if the board determines and that the suspension or revocation is based on disciplinary action, and listing where, so that somebody who has a criminal conviction can see where the board has power to say, no, we're not going to, you will be suspended or there will be a revocation. That's why we have the citations added in. The revocation is on one or more of the grounds specified in these 3 areas in the Practice Act that give the board power to suspend or revoke a license. And then taking out the last sentence. And that was the same as was done in the previous section. It felt that that's repetitive and it's only confusing to people. So, and then I discussed the sub B1 and sub B3 on this page, whereas before we simply had description of nature and gravity of the acts or crimes that we're adding in so that it's very clear to the public that you can consider the gravity of disciplinary actions or unprofessional conduct. So basically with the revisions that OAL is making across all the packages, it's to make it so that a person in the public just reading this and trying to understand, okay, how does this apply to this license? They can see broadly the board has power related to not just acts and crimes, but also disciplinary actions and unprofessional conduct. In my mind, those are subsets of acts and crimes, but OAL is wanting us to call those out to make it clearer. And then the last was in the note, the changing of adding section 481 of the Business Profession Code as an authority. And I didn't notice we had changed pages.
Okay, I just wanted to make sure I was tracking along with you so I could understand. So you'll need a motion to accept this modified language, is that correct?
Yeah, the modified language that was provided by the Office of Administrative Law.
Okay, so I will, so moved, and then we'll need a second and some public comment. And we're just moving on this particular section, 525, none of the other stuff, correct?
This section 525. Well, we'd be approving the proposed modified text for 525, 526, and 527. All three went out together as a modified text proposal and got no public comments.
Okay, so you just need us, the motion would be to approve the modified language and move forward with the regulatory process, correct?
Correct.
Okay, so moved. Is there a second?
Hi, this is Sonia. I'll second.
Okay, I think Sonia seconded there. Public comment?
Thank you. This is the moderator. I will go ahead and open the Q&A panel. All right, it is now open, so if someone would like to make a public comment, they may do so. And we'll give you a moment to access that feature. This is the moderator. I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Ed,
All right,
Ed
it's
still has his
closed.
hand up. I know Ed Howard still has his hand up. I don't know if he was able to type it in time, but he may have
Okay.
a comment.
All right, well, I will, this is the moderator. I'll go ahead and unmute him. And Ed, you've been unmuted. Did you have a public comment?
Hi, good afternoon. Thank you for your courtesy. My comment, I think, is most appropriate once you get beyond 525, 526, and 527, and you get to the 697 reg. So I will remove my hand.
Okay.
And look forward to speaking to you in a minute.
Okay, perfect. Thank you, Ed. All right, the Q&A panel is now closed.
Okay, thank you. Further comment by board members? Okay, Julie, will you call the roll, please?
Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza.
Aye.
Excellent. The motion is unanimous to move forward on those regulations. Thanks, Karen, for kind of walking us through that. Really appreciate it.
You're welcome.
Oh, okay. The last thing under this agenda item is the regulatory changes related to 697. And you already went over this. We pulled out the questionable ones with which were 545 and then the controlled substances course. And we have not moved forward. The board staff has not moved forward due to staff shortages on these regulations yet, but want to make sure that we give Ed and Kappa an opportunity to comment on these regulatory changes. So and unless there are board member comments before we open it up for public comment, we will do that. Okay, hearing no board member comments, can we please open this part up for public comment?
Thank you, Mr. Board President. This is the moderator, and I have opened up the panel. If anyone would like to make a public comment, please type, "I would like to make a comment," in the field in the lower right-hand corner of your screen. All right. Ed Howard has indicated he would like to make a public comment. Ed, if you can please keep it to 3 minutes, and you've been unmuted.
Will do, and thank you very much, Mr. President, members. Ed Howard for Kappa. So the comment that I'm going to make really goes to the process as well as to a lesser degree the substance when it comes to these set of regulations. Whereas the regulations for 0.525, 0.526, and 0.527 were quite appropriately put on the website, I cannot find in the materials proposed final language on the 697 related regulations. And there are, I guess, several issues that I have to that for that. The first is referencing my comments of this morning, I don't know whether or not there were issues related to getting the draft regulations available for the August meeting. I haven't been able to figure out what happened there yet, but there were two comments made in the webcast about concerns as to whether or not the public had access to that language prior to that meeting. But the second, and related to that, is I simply can't remember a time when a board would vote on initiating formal rulemaking based on particular language without having that language actually in the board packet and materials distributed to the public and available to the board beforehand. I simply can't recall it. Now, there are certainly parts of the regulation, proposed regulations related to 697 that I'm sure that CAPA will find to be completely innocuous and, in fact, very welcome. There are a couple, though, that I think might benefit from our ability to be able to see what is actually finally proposed to be sent out for formal rulemaking. And I think on that basis, I just simply respectfully request that the board postpone a decision on this until the time that the public and the board has an ability significantly before the meeting to be able to look at final proposed language. If, in fact, I'm correct and the proposed language contemplated for initiating formal rulemaking for the 697 regs was not in the packet, which at least I can't find. So I think that's my request respectfully made, that we briefly postpone this to be able to allow the board and the public to be able to see the final language before the actual meeting itself, before voting on.
Thank you, Ed. This is a moderator, and I have no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
So I appreciate Mr. Howard's comments. Thank you for that. And, we did talk about this at the last meeting. All of the proposed text is in the minutes for the last meeting, which are now approved and are available on the website. I think we've already voted to move those forward in the last meeting, if I understand correctly. But there will be notices and whatnot available for CAPA to make comment on that and suggested changes, if I understand correctly. So I think the only ones that sort of need more work that we're not taking any action on today are the 545 and the other controlled substances one. The other one is already moved forward. Is that correct? Am I understanding correctly, Will, Karen? Karen, are you on still?
Yes, sorry, I started talking without unmuting myself. You are correct. But I've gone to the website to look, and usually it says agenda materials and then webcast. And I don't happen to see for the August 7th meeting that the materials are there. So I understand why the speaker said I haven't seen it, because I don't see it on the website. But I had understood it went out with the materials and was a part of the record.
Zana, can you confirm whether or not the regulatory process is moving forward on those from the last meeting?
So the August meeting materials were not, we had issues converting into ADA compliance. This is, when Lynn was here. So we just, I can send that we have the materials available upon request, but that's something that we have to send to DCA to make it available. And all the language is in that meeting material.
Okay.
So just so I'm understanding, the regulatory process is proceeding on the ones we approved the last board meeting, but the concern is that those are not publicly available right now due to a problem with ADA compliance on our website. Is that correct?
So the statement that we have on the board for August meeting is that please contact the board for the meeting material. However, we do not have the material right now on the board's website, which we will put on, we'll work with DC and get it up there.
Okay, so the documents are publicly available, just not
Yes.
directly off the website. Is that correct?
Correct.
Okay, could we, if I need to make a motion for this, but as the president, can I just direct board staff to send a copy of those directly to Kappa?
Yes.
Okay, so Rosanna, if you could just do that. I mean, they're kind of a key stakeholder in this whole process. So if we could just send them an electronic copy or a hard copy of all of the regulatory changes that we have moved forward for 697, so that we can ensure that they have a copy.
Okay, I'll do that right now.
Okay, thank you.
And you are correct in stating that there are other opportunities for comment, and during the public 45-day comment, we can make changes. I just, now I understand why the gentleman said what he did about not seeing the stuff yet. And the changes are minor and simply following the statute. I don't think there'll be problems with it, but yeah, he can't say that if he hasn't seen it.
Right. Yeah, I understand his concern for sure. So we want to make sure this is as open and transparent, and we want to partner with the stakeholders as much as possible, making sure we get this right. So it's frustrating that we ran into some technical issues with getting it up there, but we can certainly make sure that Kappa has a copy, and we'll make sure that we look forward to their comments during the public comment periods and making any changes if the board approves them based on their input during the public comment periods. Further discussion from the board members? Okay, I think that pretty much, have we concluded that agenda item? Karen, have we covered everything on there that you had planned?
Yes, we have.
Item? Okay. Okay, great.
This is Will. I just wanted to confirm with Karen that, and maybe Ed, that if you look in today's meeting materials, you'll find the minutes from August 7th. And would that include, I mean, it appears to me that that includes all the language and all the changes we made to these proposed regulations. Is that correct, Karen? As in, if you just wanted to see it today, you could look at today's meeting materials and in the agenda item covering last meeting's minutes.
What I saw in the minutes was a description of the discussion, summarizing the discussion, and when you approved it, it shows the board vote, but I didn't see attached to it the materials from the previous meeting. That would not normally be in there.
No, but I do see the strike through and underlined text, not just a description, but the actual text of.
Oh, okay. You're saying that that is a part of the minutes, is attaching what was voted on, that language.
Yes, I just want to make sure it's for the same exact items that were considered here. I mean, I noticed we have 545, we have 546.
This is Jed. Just for the sake of clarity and to avoid confusion, I think what I had asked the board staff to do was to send copies of the language that the board had approved and moved forward on, so that there's no confusion in looking through minutes. So that way they'll know exactly what we approved. They have the language. Hopefully soon we will have this up on the website, but to address Mr. Howard's concern, I just wanted to make sure they know exactly what has moved forward.
But Will is correct in that further down in the minutes after the return to open session, so on the minutes starting at page 18 and traveling through to page 25 is the text that was voted on with the strike through and the underline showing the changes. So he could see it today as well as getting whatever is sent to him, because it is in the minutes. It's just not in the narrative part. It's a little later down in the meeting that we jumped around a little bit during the agenda on some of that.
Okay, great. Thank you for clarifying that, Will and Karen both, so that Mr. Howard can have some access to that, but then also he'll have a direct copy of what went forward as well without the discussion or anything. So there shouldn't, we just want to make really sure that there's wide public access and that the stakeholders have good knowledge of what's going on. So I think we have addressed that. And maybe we can open it one more time for public comment to make sure that that works for Mr. Howard and Kappa.
Thank you. This is the moderator. I'll go ahead and open up the Q&A panel. And if anyone would like to add further comment, please type, "I would like to make a comment" in the field in the lower right-hand corner of the screen and send it to all panelists. This is a moderator, and Ed Howard would like to make further comments. So Ed, you've been unmuted.
Thank you, and thank you everyone for this conversation. It's the one thing that's a little unclear, and I think this is the reason why in, I don't know how many years, 20-something years of doing this or more, I've just never seen, a board move to initiate formal rulemaking without having the actual language in front of them as proposed to be final. Is that when I looked at the minutes last night and I saw these proposed regulations in the minute, it wasn't clear to me, and again, it wouldn't be necessarily clear to me because I don't have the denominator of the prior proposal in front of me, but it wasn't clear to me that what's underlined and stricken here actually reflects what the board has instructed happen. So for example, Mr. President has correctly said that, and this is reflected in the minutes, that proposed regulation 0.545, we weren't supposed to be proceeding with that, and yet that language is here. So the language that, at least I think, the language that is reflected in the minutes has not been yet changed to reflect what the board decided to do with that language. It is true, however, that there are descriptions in the minutes of what the board voted to do, for example, and again, removing 0.545. But it appears as though that the minutes, the language in the minutes is the language that is supposed to be changed prior to going out for public comment, as opposed to final language where this could serve as a substitute for having proposed final language to vote on to initiate formal rulemaking. Again, I can't look you all in the ear and say that I'm 100% confident of that, but the existence of 0.545 implies to me that, in fact, this is the language that is supposed to be changed, as opposed to the language that reflects the changes that the board voted on. And I think it's just, as I said, I'm not clear because I haven't yet had a chance to speak with the folk at Kappa in any detail about what's in the minutes. It's not at all clear to us that there's anything here that we would oppose, but it just is far cleaner for the record to do it kind of the normal way, which, especially given the fact that there were issues with getting documents out to the public on the website in the normal sense of that I've come to rely on for all boards, which is they post their materials and that's what's going to be in the meeting. It just is a lot cleaner when it comes to these regs to kind of reboot a tiny bit and re-engage the normal process. But thank you again for your consideration.
Thank you, Ed. And this is the moderator. We have no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
All right, it's been closed.
Okay, thank you. Any further comments from board members? All right, very good, thank you. So let's see, I think that takes us up to closed session. I don't see any other, well, just the legislative committee which I think will be pretty brief. So I think what might work is if we do the legislative committee break for lunch and then just come back and immediately go into closed session. And then we will adjourn immediately after closed session so that there won't be anything else for the public after lunch. Does that work for everyone?
Jed, we do have item 16, which is the report about what occurred during closed sessions regarding executive officer appointment. Given all the technical issues that are surrounding that, and that folks would have to stick around until a indeterminate time, we can not, take up that item. We can push that item until a subsequent meeting as far as our reporting out, if that's what the board wishes to do.
Yeah, I do think that 16 should be pushed until later because even when the board, after the board makes those decisions regarding the executive officer, the person would have to accept that, and there's a fair amount of background stuff that has to happen. So I think that item probably would be better pushed to the next meeting, if that's okay, or just announced on the website or something. Is that acceptable?
It's acceptable to me if it's acceptable to everyone else.
Any comment from board members on basically not taking any action on item 16 today? And so the purpose of this is after our closed session, we would not return to open session. And the purpose of doing that is so that the members of the public are not hanging around for several hours after a closed session to hear a very short statement. So I think it would be better to just not take action on that item. Looking for a comment from board members, either for or against not taking action there.
This is Sonia. I would agree.
Thank you, Sonia. Okay, hearing no other comments from board members, we will not take action on item 16 on the agenda during this meeting, which means we will now have the report by the legislative committee. And then following that, we'll break for lunch. And after lunch, we'll return and immediately go into closed session.
The legislative committee would like to begin with AB 890, and that was produced by Wood. That is the nurse practitioner scope of practice without standardized procedures. And if you remember, that bill requires the board to establish minimum requirements for nurse practitioners to transition to practice independently, amongst other provisions, and that was signed. Well, actually, the board took no position. It was signed by the governor.
I'm sorry for interrupting, Sonia, but if I could ask the moderator to mute wherever the noise is coming from. Thank you. Please proceed, Sonia.
Yes. Just taking it back, the board took no action on that position, and the status is that it was signed by the governor at the end of September. And then next we have AB 1616. That was by Lowe and Garcia, and that was the Department of Consumer Affairs boards, and where it relates to expunge convictions. And if you remember, that bill required programs under the DCA that posted information on the website about the revoked license prior to criminal convictions to update or remove that information within 6 months. The board also took no position, and that bill failed passage and is currently dead. AB 21 by Lowe, that regards to the refugees, asylees, and special immigrant visa holders regarding the professional license and initial license process. That bill required programs within the DCA to assist and expedite the initial licensure process for those applicants who supplied satisfactory evidence that they were either a refugee or an asylum or also immigrant visa specified. And that was also signed by the governor and has passed at the end of September. And then SB 53 by Wilkes, that's the open meetings referendum. And so that bill modifies our current Bagley-Keene Open Meeting Act to require 2-member advisory committee of the state body to hold open public meetings. And the board took an opposition to this as our board utilizes two-person committee that has no decision-making ability and is required to report to the board. Currently, it is held in committee under submission. SB 878 by Jones, and that was the Department of Consumer Affairs license application and processing timeframes. If you remember, at the beginning of January 2021, this bill will require each board member or each board and bureau within the DCA that issues licenses to prominently display on their websites and update quarterly basis either the current average time frame for processing and then also combined current average time frame for processing both initial and renewal license applications. And that was also signed by the governor at the end of September. SB 1474 by the Committee of Business, Profession, and Economic Development. That bill was also, if you remember, that was a bill that provides a 1-year sunset extension for a host of boards and their programs undergoing the sunset review processing prior to COVID-19. And that bill was also signed by the governor at the end of September. And lastly, we have SB 1463 by Glacier, and that regards the written examination for PAs. And that bill would remove the requirement that the board establish a passing score, which we already talked a little bit about, and a time and place for that examination. And so that is currently dead. And that concludes the legislative report.
Thank you, Sonia. I just would like to ask board staff, did a letter ever go out to Wilk on Senator Wilk on SB 53, the open meetings? Did we ever notify the author? Rosanna, are you on?
I'm sorry, my mute wasn't unmuting. I will check. I'm not sure if Sonia wants to speak on that because I don't see any record of it being sent.
No, I don't have any information on that. I'm not sure. I think maybe we can look at the last minutes to reflect on what was done, but I don't have any record of that either.
The last meeting, we made a motion that moving forward, we will be sending letters.
So there's 2 meetings now that we've had where we asked a letter to be sent to the author. Unless the bill is dead, which it doesn't look like it is, I think it's important that this bill would really have a bad effect on our board. So I think it's important that we let the author know that. So if we could just make sure that that letter gets sent, I think that's important. Is there?
I would agree. I can work with Rosanna to do that if that comes from the legislative department or legislative team or.
Yes, we'll work together, Sonia, on that.
Okay. Does anyone on the board have any objection to notifying the author of our opposed position? Okay, good. So I just think it's important we communicate with, the author of bills when when there's something like this. So appreciate the legislative committee and the board staff working towards that. Sonia, did that conclude your report?
Yes, that concluded my report.
Okay, any comments from board members? Okay, any public comment on the legislative report?
This is the moderator. Thank you, Mr. Board President. I have opened the Q&A panel. If any members of the public would like to make a comment, please type "I would like to make a comment" and submit it to all panelists using the field in the lower right-hand corner of your screen. And we are displaying instructions for your reference. This is the moderator. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Okay, the last item that we will go to before we go to closed session is items to be placed on the next agenda. This can come from board members or members of the public. We'll open it for public comment here shortly. But covering things that we need to have on the agenda, I think certainly we want to make sure that the regulatory changes for the for 697, all of the regulatory changes, but specifically for 545 and the other change related to the controlled substances course. I want to make sure those are on the agenda. And the education, I don't know that there will be a lot of changes for the Education and Workforce Committee because the accrediting body will not have met yet. Dr. Alexander, if you want to keep that on there, we can, or we might just put that off till the next meeting.
Yeah, I'm fine with whatever you want to do with that, Chuck.
Okay, I would say we probably don't need the education and workforce on there because there won't be any significant change between now and February. Any other items that the board members would like specifically placed on the agenda? Okay, public comment on items to be placed on future agenda.
All right, this is the moderator, and I have opened up the Q&A panel. If you would like to make a comment, please type "I would like to make a comment" in the field in the lower right-hand corner of your screen and send it to all panelists. We are displaying instructions. All right, this is the moderator. I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Okay, thank you. So now I think we've covered everything on the agenda except for closed session. So we will adjourn for lunch and for 1 hour. And upon returning from lunch, we will immediately go into closed session. And so Will, unless I'm missing something, I think we can adjourn for lunch. Just before we go very quickly, I see that Mr. Howard still has his hand raised on there. And if there was, I'm wondering, I see it went away now. Okay, I just want to make sure he had the opportunity for comment on the next agenda if he needed it. Will, is there anything else that we need to do or cover before we adjourn? I just don't want to lose our members of the public when we come back. I just want to make sure I didn't miss anything.
Yeah, this next few steps are going to be a little just tricky technologically. You shouldn't all have to worry about it. It's mostly between myself and the moderator. But basically, I noticed we only have 4 public attendees currently. But if you are a public attendee who's going to at some point be roped into our closed session, and you know who you are, correct me if I'm wrong, Madam Moderator, but they should hang out here in this meeting that we're currently in. And as they're needed, myself and or the moderator will essentially pull them into a sub meeting, which is going to be our closed session. And the same goes for all of our board members. You'll be automatically placed in the sub meeting as well. Is that about right, Madam Moderator?
This is the moderator, and yes, you are correct, Will. So for meeting participants, members of the staff who won't be participating in the closed session, you can go ahead and log off for lunch, but everyone else that's a meeting participant, including the member of the public that might be in the closed session, please stay logged in this meeting. Just for the lunch break, all you need to do is just mute your microphone.
Okay. Who among staff members is going to be our designated note taker for closed session?
It will be Christy.
Christy? Okay. Okay, so we'll keep her.
Yes.
Okay, very good. So does that about cover it, Will?
Yeah, for now. We'll see you. We'll see you all back here at 1. I don't see Pa in, but hopefully she will join around 1.
Yeah. So okay. So the PA board will be in recess for lunch for 1 hour. We'll be back at 1:05 p.m. Thank you, everyone, for being here. We'll see you in an hour.